Okay. Good morning. The November 3rd, 2022 Disciplinary Review Committee meeting of the Texas State Board of Dental Examiners will now come to order. The time is 9:11 a.m. As far as protocol, be mindful of turning down the volume on your computer. We have microphone buttons in this newer facility that we're at. Please be mindful at pushing those to give an audio response. And now we'll move on to the mission of the Texas State Board of Dental Examiners. The mission of the Texas State Board of Dental Examiners is to protect the public health and safety and promote high quality and safe dental care by providing enforcement, licensing, peer assistance, and related information services to licensees and their patients. Now for roll call. Ms. Nichols, can you go ahead and perform roll?
Yes, sir. Dr. Robert McNeil.
Present.
Dr. David Yu.
Present.
Dr. Yvonne Maldonado.
Present.
And Dr. Margot Melcher.
Present virtually.
Thank you. Everyone is counted for.
All right, we have quorum. Thank you for joining us virtually, Dr. Melcher. Okay, let's move on to item number 3. Committee recommendations and possible action on preventative disciplinary measures. And for this component, I just sort of want to open the floor. I know we had sort of discussed the topic at our previous meeting, and it was we were trying to at least put forth how can we be more proactive with what we do and the lens at which we look at what we do as an agency. And we had some clinical vignettes put out, and we had a pretty robust discussion about that. Do I have any comments, questions, concerns, thoughts from fellow committee members? I'm going to look to Dr. Melcher. Trying to find her there. Okay. Hearing none from committee members, Ms. Nichols, do you have some thoughts?
Yes. So at the last board meeting, I suggested that I reach out to other boards, other licensing regulatory boards, and to see if any of them are doing clinical vignettes in their newsletters or any other publications. And I did, and no one is.
Okay. And I think some of the discussions I've had with some people is, we don't want to have concerns if we put information. What do we want? We want information out there that can be helpful to people. And if we see things that are occurring, especially from a patient harm standpoint, from a practitioner harm standpoint, what duty and obligation do we have as a board to try to get those informational services out there, which quite frankly fulfills the mission of what we do as a board. I think part of the challenge is when it comes to individual treatment, we certainly want to make sure the practitioner has the ability to treat that patient as they would see fit within the parameters of the rules that we've established. But I think there can be a way that we can satisfy a variety of different measures there. So that's something on my end. I'll try to work with that and sort of communicate with legal. I think part of the challenge is it gets tricky when we start putting out opinions of clinical care. One of the comments that I had received from some people was, well, maybe don't give the opinion of what happens, but maybe just to address certain issues and say, here's a typical patient scenario. That's something that may be helpful. Maybe it's to the point that people on this committee, if there are preventative, proactive things that you think we can get out there informationally, maybe that's something we can put in the newsletter as far as a proactive minute, and whether it's in written form, whether it's a video type of thing. And once again, be mindful of all sorts of parameters and threading the needle. But I think anytime we can look at anything and say, can we be proactive? We certainly, we don't want overreach. And I think that's something to always be mindful of. But we have information that can be helpful at many times. So any other comments from committee members? Yes, Dr. Yu.
Well, I like the fact that we're talking about this, because I think, for licensees, and part of the board's mission is to propagate information services to the public. And, having clinical vignettes are typically the most effective way to communicate or have case scenarios for the public to really kind of understand board rules. I mean, you could look at the board rules and say, okay, this is the standard of care, and these are what a prudent dentist would do. But what is it? What are some examples, and what has the board seen? So I understand the concern about identification of cases and risk for legality issues. But I do agree that, talking about this is a big deal, like for TDA and other trade organizations, and maybe having some vignettes out there that they can help, or even attorneys can help with, that they've seen. So in a way, we can kind of help encourage it, but not have the board directly involved with it.
Right. And I just on your point there, David, Diane Rose with the TDA had a great article that basically kind of reposted the standard of care issue that we had put out in the newsletter. And I think certainly that is a venue that's quite helpful in continuing to talk to stakeholders.
Yeah, thanks for your work.
Unfortunately, a lot of people, are not TDA members. And that's one of the things that I like about our newsletter, and kudos to the entire team here that have really, and it's something that will continue to evolve for sure. But that's our one means to kind of get information out there.
Mm-hmm.
And I would push us to continue to, have board members put information in there. We're going to have to adapt and figure out how we do that. And I know it's a lot of people on the team here are involved in that.
Dr. Melcher has her hand raised.
Oh, okay. Dr. Melcher. See her on.
Good morning, everyone. And just I was just thinking this out, as I know you brought this up last time about putting these vignettes and things. My only concern is that the time that it'll take. I know you might be willing, as chair of this committee, to do this, but my thought is, why don't we maybe ask, or it be put out there that the Texas Dental Hygienists Association, the Texas Dental, maybe they do some kind of CE or some kind of webinars on this, and take that out of our hands, because we have our rules and our regulations that, we put forth. Maybe we highlight a rule at each newsletter, but I think this step that you're wanting to do, I think would be more in the hands of the associations or CE providers, just to do like a webinar, on occasion. So that's my personal opinion. Thank you.
Gotcha. And I appreciate that opinion. And I think this realistically, when it comes down to patient safety and practitioner licensee safety, and we're going to talk about that in our next segment, it's certainly an all hands on deck can be helpful. What I do worry about is that some people are not members of organized dentistry. And when I had an opportunity to talk to my own specialty with Amos and talk about some of the safety simulations that they do, and I said, who probably needs these simulators the least are the people in this room that have already used those simulators. The non-members, the, non-OMS could benefit from those. So certainly an all hands on deck, and I am mindful of time requirements and then the issues that legal would have with all those. So I would say a work in progress, but I want to push you guys to think through the lens of trying to be proactive as opposed to being reactive in many things that we do. Any other comments before we move off that agenda item? Okay. Let's move on to item number 4, recommendation and possible action on licensure application questions pertaining to mental health. To give a little touch of background on this, and I know there were several documents in the information packets that was sent out. Part of this discussion was at the ADA annual session, one of my guests on the podcast that I was doing was Mia Geisinger, who's a periodontist out of University of Alabama. And she was part of a group that did a lot of research on mental health issues kind of during COVID and kind of as we move out of COVID, with mental health issues related to dentists and dental hygienists. And there were some pretty significant issues that they were finding because of everything that people had gone through as far as an uptick in mental health issues. Second to that, we actually had George Shepley, who's the current ADA president, who was on our podcast and talked a lot about self-care. And, you know, we can't take care of others if we don't take care of ourselves. So there's a big push nationally. The one document in the packet, the National Plan for Healthcare Workforce Wellbeing, that document had just come out fairly recently. If you look at the start of that document, you know, many organizations represented through that, the ADA, the AMA, the American Hospital Association, the Nurses Association, the Veterans Association, I think, you know, the Surgeon General, it's a big group, and people realize that it's to the point of a crisis. And part of that document, and once again, that's that national plan, page 40 of the document, which I believe is page 49 on our computer if we go through it, it reads off goal 3C. And I'm going to read it out here as stated. Goal 3C is convene state licensing and certification boards to accelerate appropriate changes to mental health reporting requirements, reduce stigma, and normalize the process of health workers to seek help for workplace-related stresses. So I'm going to put that out there. The last one that I'll reference was the article from the Journal of Medical Regulation. And that's actually a terrific journal. It actually doesn't cost that much. It's this tiny paper journal that you get in paper format, but also online. It has some really great information articles in there. Just talks about education plays a key role, but policies and procedures that make it safe for individuals to seek support for mental health conditions is very important. So part of what I want to do is open up this as a discussion point, similar to what we did with proactive. Ms. Nichols, I'd asked her to kind of put our current questions, our current licensing applications in there for initial licensure and then continued licensure. And I believe, do we have a representative for PRN who's joining us virtually?
Is it Will?
Yes.
Will Turney is joining us today.
Will, okay. And so perhaps we may get some input from Will as needed. But so there was a lot of information. I just said a lot of things there. Do any committee members have any comments, questions, guidance at this point with what we're discussing? Dr. Yu.
You know, in the past, we've had stakeholders, you know, bring up mental health issues, especially, you know, post-COVID and all of that. And I think it's part of the public awareness as part of the initial patient intake. For instance, when we go over medical history and, you know, cardiovascular issues, respiratory, all that. I mean, mental health should be part of that questionnaire also. If anything, to make them aware that, hey, there is help for you, you know. But I think, you know, however we do this, I think, you know, public awareness is important with this. And I don't know the numbers, but I know that it's a much worse situation since what we've gone through. I'm sure.
And that was certainly part of what that research that Dr. Geisner was part of, and that's certainly what they found.
Right.
Yes.
So we're not only talking about just the patients, we're also talking about the providers.
Well, I'm
Or are we just
specifically talking about the providers here.
Oh, the
Okay,
providers.
yes.
This. And basically what I was trying to do is have us look at our current application for licensure inputs to say, are these reasonable and prudent questions? And a lot of times a question will be, have you ever? And that's a nice catch-all. But what these documents that I kind of uploaded and what the national plan kind of talks about is there's stigma with that. And if you are a dentist and you're trying to look at things and say, do I need to seek help? Decreasing barriers, decreasing stigma can be prudent things to do. For instance, when we have the questions on our licensing applications, do you currently suffer from a substance abuse issue, including alcohol? It may be prudent to put the PRN contact information right in that section on the licensure application as well. And that's what has proofed out with some of, if you look at how to be effective, just say, by the way, here's our confidential contracted agency. If you do have a challenge, if you have a mental health question, if you have a question such as, the latest is kind of not talking about the past as much as far as saying, do you currently have an issue? And that gets into physical issues. It gets into cognitive issues, quite frankly, and that's going to be a bigger issue as we move forward, and then mental health issues. And so if you have a question like, do you currently have a physical, cognitive, or mental health condition that impairs or limits your ability to practice dentistry in a competent, ethical, and professional manner, then that kind of fits in with some of the American with Disability Association compliance issues. It says, is it currently an issue for you? Does that make a provider have an easier time seeking care as opposed to have you ever questions? We all kind of, as you deal with disability insurance, for instance, you look at it and say, boy, do I want to get that MRI of my neck that shows something for pre-existing, because what's out there. I guess maybe is this a time that we can get our PRN representative to just make some general comments if you would like about destigmatizing? Maybe before we go, let's go to Dr. Melcher while we're getting our PRN representative here. Yes, Dr. Melcher.
So Dr. Randall, a couple of things. So I do recall our PRN group providing, they had a PowerPoint, or they had a CE or a webinar, right, through the, I guess it was last August, that they had presented at their report, which I thought was wonderful. And then the second thing is you're asking about the question, these questions in the application forms. So I see on our dentist form, number 7 already asked, says, since your last renewal, have you been diagnosed with any condition or impairment? And it does list mental, emotional, or nervous disorder. So I think we have that covered. But I do like the fact of how you said putting a resource like the PRN, if needed, on there. I think that would be a good that you're wanting, since it's already on there.
And you broke up a little bit at the last point there. So let's, with the comment that you made, I think it was item 7 on the renewal application.
Mhm.
Is that correct?
Yeah.
And so if someone was, okay, since your last renewal period, we're renewing every 2 years. A year and a half ago, you were diagnosed with depression. You're being treated for depression, either medicines or therapy. And now you're stable, do not have an active mental health issue. You would have to answer that question 7, yes.
You would?
Would you
Because
not?
it says in
Oh.
any way affects your ability to practice as a dentist. So if you're taking some kind of medication and you're stable, then why would that be yes?
Well, and if we read the question, and this is where we'll get legal involved as well, since your last renewal, have you been diagnosed with any condition or impairment? It doesn't say, is it active right now? Have you been diagnosed with that? So,
But it also asks in any way that affects your ability to practice as a dentist.
yeah. So you could look at it and say, well, did it affect my practice a year and a half ago?
Mhm.
Or is it affecting my ability to practice right now because it's a treated condition? I think part of the push nationally is certainly to look at something like depression as something like hypertension. It's a medical condition with parameters for diagnosis, parameters for treatment. Yes.
I do have a concern, when I read all this material, when I read the material, that 300 to 400 physicians, commit suicide a year. And, or they go get help from a friend because, they don't want it documented, or they self-medicate. So I think those are serious issues, whereas perhaps there could have been some intervention for them, and there is a stigma.
Yeah.
So how do you get around, those mental health issues, without it affecting your license, if you can get treated without, taking your own life?
Exactly. And obviously dentists were right in line, if not a higher suicide rate. And, I think most of us probably know dentists who have committed suicide.
Dr. McNeil?
Oh, yes.
I think in the discussion, I just think maybe this number 7 maybe just requires a little bit more wordsmithing, if you want to add something. But I think that for the most part, we've got it, it's there, just adding a few more little details and then adding that resource, I think would be beneficial to our, our licensees, because as Dr. Maldonado stated, some individuals may not want to reveal that, and we can't, what they put on there, we're going by their, by their word, whether they're divulging that information or not. But I think just if we wordsmith and maybe add the resource to the PRN, from where you're concerned or your comments, I think could help our licensees.
So those are good points. And let me run a scenario. Well, let's have PRN. I think was it
Will,
Will.
Mr. Turney.
Will, do you want to jump into the conversation here to provide any input from your perspective?
Yeah, sure. So, as you all have noted, we have seen an increase nationally in mental health and substance use issues. And that's also reflected in dentists as well. We have not really seen an increase in numbers at PRN. We've actually seen a decrease over the past couple of years. And we think one of the reasons for that is we haven't had as much of a chance to go in person to schools to present about PRN and what we do, and get the word out that we are a resource. And I think some people are hesitant to call PRN because even though we do have a confidential process, they know that there are certain scenarios where they would have to be reported to the board. And, they've heard situations about people being reported to the board. And so PRN there's a stigma around us, being the person that will ultimately end up reporting them to the board, which is not the case in every scenario, obviously. And we want to get the word out that, we are a resource. And I think as things are in person more this year, and for events coming up, we'll be presenting our program to more schools in the future. And we want to find ways to get the word out about our program to people who aren't students. So people who are already providers, since they're not in school, we're not necessarily presenting to them. So if there's a newsletter or something where we can make ourselves really visible and show that PRN is available to you and we are confidential and we're not here to report you, all that, I think that could go a long way. I'm not super familiar with what the application looks like that you all are talking about, but I do think it's a good idea to have PRN on there just to mention that we are a resource and provide a little bit of information about the confidentiality policy so that people aren't afraid to include that information.
Thank you, Will. Ms. Nichols?
Yeah.
That's a really good point that we'll just, is that if a provider willingly goes to PRN, they don't necessarily need to talk about it, and PRN doesn't tell the board. So I think just reminding people of that the confidential nature of engaging in treatment with PRN is a positive thing. Because would it be the committee's expectation that if a person was already engaged in PRN, that they would check yes to question 7?
Yeah.
It would be, you would say they should say yes.
So it depends on the wording of the question. And I think the current wording of the question would be yes. You know, that's where I think giving some thought to this, and I think what I hear you all say is that if we're asking a question about substance abuse, then we should probably have PRN's information there. So when they're looking at the application, okay, here's confidential, however we want to smith that. And but that's where we just have to look at the question. You know, if we go to if we pull up our current initial licensure form, I did just have that. It's more of a have you ever question.
Yeah, have you ever been diagnosed?
Yeah. Small donut.
I'm still going back to that same part that in any way affects your ability to practice as a dentist. So that's very open.
It's open, except now we're talking about a time frame. So since your last renewal, a year and a half ago, I was diagnosed with depression that potentially in any way impacted my ability to do that then. But right now, no, because I'm being treated. And the question is asked since that last renewal, yeah, at some point there, I had impacted my ability to practice, but now I'm treated. I think you'd have to answer the question to the affirmative. Yes, you had a condition, and then you have to fill out an affidavit. So let's talk about from a legal standpoint. I put down, I had severe depression since my last renewal. And I've talked a little bit with Ms. Mendez about how it's handled. So my licensing form goes in, I put something on there that says I started going to individual therapy and I'm doing better. Where does it go from Ms. Mendez group?
It goes to the legal
It goes to
division.
legal. And then legal looks at it. And then how would that be handled?
So we need some proof that the dentist is safe to practice. So we need some doctor's notes saying that they're safe to practice, something saying that he's safe to practice.
Okay. And then if I put down, so any mental health,
Any type of mental health medical issue that would affect their ability to practice.
okay. Any other comments from committee members on that? Dr. Yu?
I actually do like the qualifying statement since the last renewal,
Mhm.
because otherwise,
Yeah.
if they've already been, vetted and legal's already said, okay, you're fine to go. 10 years ago, they still have to keep putting down legally that, because this is so open-ended as far as have you ever been diagnosed? So I at least like that frame,
Mhm.
And my only challenge with that is it still takes it back in time as opposed to a current attestation. of the current time period? And does it do anything to destigmatize these people who are needing care? You know, it's great, and I'll get to you in 1 second there, Dr. Melcher. It's great that PRN numbers are down, but it's terrible that PRN numbers are down, because we know from the evidence that everything's going the other way, and they've had limited access. There's articles out, I think it was in the ADA journal for the dental educators, the drinking for dental students and just what's happening, substance abuse at the schools is a pretty significant issue. I'm just not sure since your last renewal, I don't think that destigmatizes at all, because you have a diagnosis of depression. Now, I think many people would not answer the question yes, because they would
Right.
look at it as, no, I was depressed. This didn't affect my ability to practice. I still went into work. I was in a depressed mood, met criteria, but I was safe to practice. So I'm not going to answer the question affirmative. And if you do answer it to the affirmative, then you got to go through, okay, now I got to get a letter. Now I've got to get an attestation from my therapist, the doctor. We're not doing anything to destigmatize there. Frankly, we're punishing those who are open and honest about something. That's my take. Dr. Melcher?
So I think where you're coming from, and then just what's already on our, on the questions for all the, the renewals for hygiene, for dentists, and the registrations for dental assistants, then we put down, such as in number 5 and 6, it says, are you currently? Then you're wanting that word currently in there, so you could ask, are you currently, or since your last renewal? You could then continue on with the verbiage. But I mean, the way that I read it, I think it's, to me, when I think of since your last renewal, that's the time period of when you registered to now. So I feel like it encompasses, what you're trying to find out. So, I mean, I don't really have a problem with the wording of it. I think it takes care of it. But if you want to add currently, I think then just to be succinct with number 6 and number 5 and 6 right above it, then you could add that to it. That's my recommendation.
Gotcha. I'm going to read this comment that I had read before, just in part of it, it took some of the information that we currently have on there. Do you currently have a physical, cognitive, or mental health condition that impairs or limits your ability to practice dentistry in a competent, ethical, and professional manner?
Can you read it one more time?
Sure. Do you currently have a physical, cognitive, or mental health condition that impairs or limits your ability to practice dentistry in a competent, ethical, and professional manner? And so that gives a snapshot in an attestation at the time. Is anything perfect? No. Do I believe, and especially based on the reference articles and the national plan, does this help destigmatize? Yes, I believe it does. Let's have legal input, if there's any.
The only thing I'll say is that we like to keep that question broad because it's a safety, it's a patient safety aspect. And so we keep that question broad because we want to make sure we're covering all our bases and to make sure that we're monitoring dentists who need the help before they can practice on patients.
We had just had a conversation about being proactive, right? Proactive in preventing our licensees from having disciplinary actions too. In my opinion, this is a way for us to be proactive in our other duties that we're required to do as a board, in that we're protecting the public, right? I understand, certainly from personal experience, what it's like to have a mental health issue. And I understand that there's a stigma around it. I'm very open about mine. It's fine. I know not everyone's like that. However, I do think it is a relatively small price to pay to answer that question on your renewal application honestly. Submit your affidavit with appropriate documentation, because the flip side of that is if it comes out later, if we see that you indicated no, we may try and take your license for lying on a renewal application. So I think the affidavit part of it, providing that documentation is, again, a relatively small price to pay. And we've recently gone through a couple of applications where Lauren and I have taken a look at them with additional information, having a clearer understanding of what exactly is going on there and then passing the application through. So if we're going to be proactive in preventing our licensees from having issues with us as far as disciplinary action, I think we also have to be proactive in protecting the public.
Dr. Maldonado.
So would there be any verbiage that could explain that anywhere? Or does it just go out to all the members in a newsletter? Just, this is what you need to do to be proactive, or no?
I
Or
mean,
this is what's required, or is it explained somewhere?
I guess we could explore whether we need to be more specific about the information we'd want in the affidavit.
And
But
everything
that's
we're
too.
discussing now makes everything worse for stigmatizing, in my opinion. If we look at it and perhaps we're opening a can of worms, sometimes that's what I do. And if we say, okay, you've been diagnosed with depression, you need to attest to that on your form. Even though you're treated, it's not impacting your ability to practice safely. And certainly we have obligations to public safety and practitioner safety. And what we're looking at here is, how are people going to answer that question?
Yeah.
To get back to, okay, I was diagnosed with depression a year and a half ago. I'm treated right now. I'm doing my renewal. It's not an issue at all. If I'm following the letter of rules here, I have to answer yes and have a letter. And we're talking a significant portion of our licensees are probably affected by this issue. Ms. Nichols.
I had a question for Mr. Attorney about PRN participants who the board is not aware of. They're not board ordered. They went willingly and they are engaged in PRN willingly. Does PRN tell those applicants that they need to notify the board of their PRN participation? I'm assuming no, right?
That is a great question. I know that has come up before, but I don't have a answer to that. I always I wish I knew. Can I get back to you all on that?
Sure. I was thinking the answer was no. I'm not trying to answer for you. Just
Yes.
because that would be part of the appeal going on your own, is that you're getting a jump on your own health and taking matters into your own hands in a confidential way before the board gets to go.
Yeah.
But I don't know what guidance PRN gives people.
And I think
The
what I'm
answer is no.
feedback
But
here. Will,
I'm
did
not
you
positive.
comment there?
I'm sorry, can you hear me?
Yes. Did you have a further comment to that?
No, I just, I think that the answer is no. I think they're not required to tell the dental board, but I think what we've usually done in the past is we contact you guys and double check, because that would be your rule and not ours. But I can't remember what the answer was in the past.
And Will, can I ask you a question? I know there's a lot of entities. What percentage of people roughly would have just a mental health issue and not a substance abuse issue that are engaged in PRN? Is that a very, very small?
It's very low. I would say maybe 5% or less.
Okay.
I think substance use issues come out more easily in terms of like legal issues such as DUIs or diverting medicine or things like that. But mental health issues are can be a little bit more difficult to detect if there's not a outright episode.
Okay. Thank you, sir.
Mhm.
What I want to do is Question number 7 from our initial licensure application. So this is not the renewal, this is the initial. Have you ever been diagnosed with any condition or impairment, including but not limited to substance abuse, alcohol abuse, or a mental, emotional, or nervous disorder or condition that in any way affects your ability to practice as a dentist in a competent, ethical, and professional manner? That's the initial licensure application. And that is a have you ever question. And we may look at it, is it a difference for initial licensure versus renewal licensure? Anyone have any specific comments about the wording there for initial licensure?
And I want to reiterate, the goal of these questions is not to punish people who are already being monitored and are either under medication or under a doctor's care. The goal of these questions is to make sure that those who are not being monitored and who need the help and assistance to get that help and assistance.
Okay.
So, and some of those questions, I think one of your scenarios was if a dentist was diagnosed with depression and just taking medication is under the care of the doctor, then I would think that they would answer no to those questions since they are being monitored and they are under a doctor's care.
Because
Yes. Ms.
because just like with any health issue, I mean, the person might have a heart murmur, the person might have anything that could impact their
Atrial fibrillation, you get
right. And
Rheumatoid
it's
arthritis.
right,
seizure
No.
disorder.
right. And so I think to destigmatize, which is the goal,
Right.
we treat it like any other health aspect.
Yes, Dr. Maldonado.
So PRN can also help people with mental health issues, just not substance abuse or
Both.
alcohol abuse. So all those things. Okay.
You know, there's usually such a comorbidity between the two that I think that's where they get engaged with that. You know, Texas, I was looking if we say, okay, if we're going to ask about substance abuse issues on the licensure application, let's have a line for PRN confidential resource that we use. If we're going to ask about mental health issues, you know, the Texas actually has a really pretty great website. And there's actually like 911 we have for emergencies. There's 988. I didn't know about that until I started looking at that. And there's, I think it's the Texas branch through Health and Human Services is mentalhealthtx.org. And it's really a pretty good website that you go to. So I think to kind of end off this conversation that we have, just like before it being proactive, I think maybe between now and the next meeting, let's give some thought and interaction on some of the things that we've talked about. Maybe look at some nuanced things there that we can add into that. I'd be a big proponent, as I said, it just if you're going to ask the question, have, you know, kind of board affiliated PRN confidential, let's consider some mental health thing to put down there. Once again, to get people the help, because that can be the point when you have to answer a yes or no on a licensure application, a licensure renewal. Most of us know how big a deal that is. And that can be, quite frankly, a sentinel moment for people. Dr. Yu.
I like how you brought up this topic. It's immensely important. I actually like the idea of putting that maybe the state website as, you know, on this. You know, my issue with putting potentially, and like to see what, you know, legal things of putting PRN on this application is that, you know, you may not be helping PRN, if anything, because, you know, the licensee may associate PRN with the board, you know, and we were kind of linking the two together. So I just wanted to see what, or is it appropriate to put PRN? on
Well,
there?
we're pretty linked and we say this is the group that we work with. If, you know, I think it's important to have wordsmithing that talks about this is a confidential group.
I see what you're saying. Doesn't give them autonomy as a
Right.
separate organization.
You know, but they're also, no offense, I don't think they're out there blasting their information on billboards and whatnot. So I think we have an obligation and duty, and it's on our website of these are the people that we engage with. Perhaps part of a preventative, proactive kind of thing is we look at perhaps referencing that mentalhealthtx.org, and maybe I try to wordsmith something with legal that we put in the newsletter and just say that we had a robust discussion, a disciplinary review about mental health, and can reference some of the stats just showing that we appreciate that it's an issue. Just so we don't cause a huge ruckus, if on the renewal form, if someone has treated depression and it never impacted their ability to practice in a safe, competent manner, we are all agreeable that the answer to the question would be no.
Right.
And legal's in accordance.
Dr. McNeil, could you state that again? I could not hear the last part of it.
Basically stating if someone had depression, they sought treatment, either medically or therapy, it did not at any point impact their ability to practice, then they can answer that question as a no. Is legal comfortable with that statement? And part of why I bring it up, I don't want to have an issue after this meeting, because once again, the challenge with having a robust discussion where you're opening a can of worms that, quite frankly, I think we need to open it. We want to have clarity there. And these are all self-attestation questions. A catch-all is nice because it's just like when you're out there on a fishing vessel and you got a big net, you catch everything. Well, you catch dolphins and all these other things, and mermaids if they exist. You catch all kinds of stuff, which can help in a legal standpoint. And I am prepared for legal is going to think one way and a board member is going to think a different way. And someone who is trying to destigmatize mental health issues is going to have a different nuance. Is there a perfect way of doing this? I don't think so at all. I think if we look at it and say, by how our questions are asked, is that going to have an impact on someone seeking therapy or treatment that they need now or in the future? Because those questions are significant. They really are. And whether it's for hospital appointments or certainly licensing, it's a big deal. Quite frankly, as I read our questions, especially on initial licensure, it doesn't jive with some of the recent things that are coming out as far as just the, have you ever, if we look at that question, mental nervous disorders, we haven't updated these in a long time. And as I said, let's continue this discussion. Is legal prepared to have any sort of input on that last item?
Dr. McNeil, I'm not comfortable giving a yes or no. I think each applicant should seek the advice of an attorney. I will go back to what I say previously, is that the goals of those questions is not to punish someone who's already being monitored and already under a doctor's care.
Yeah, so kind of like a case by case.
A case by case. And once again, this is an attestation of did this, let's read the exact wording. Since your last renewal, have you been diagnosed with any condition or impairment, including but not limited to substance abuse, alcohol abuse, or mental or emotional or nervous disorder or condition? I don't think we call them that anymore. That may in any way affect your ability to practice. That's a big catch-all. That's a big net behind a fishing boat.
Dr. McNeil?
Yes, ma'am.
But as I'm looking at the attestation statement right underneath that question, I think it covers the expectation. And again, we're putting our trust that each individual is going to answer these as honestly. I seem to think that I feel like we're covered. I feel like I agree with legal. I think there's, putting out at the verbiage or the other things is not, may not be as what you're wanting out of this. So, I feel like we, like I made the suggestion, if we need to make a motion to maybe just change the verbiage on that so that it's succinct with numbers 5 and 6. But if not, I mean, I think we have that attestation already.
Okay. Well, thank you for those comments. What I recommend is we'll further discuss this issue. We can think about it between now and the next meeting. And quite frankly, I'm thankful that all of you engaged in a fairly robust topic that's incredibly important, incredibly nuanced, and rather tricky at times to thread the needle here with what we want to do to balance out safety for everybody. So no further comments on that item. Okay. Do we have any public comments at all? Seeing none, do I hear a motion to adjourn? Dr. Maldonado, second. Dr. Melcher, all in favor, say aye. Aye. Thank you. The time is 10 a.m. Meeting adjourned.
Thank you, Mr. Attorney. We appreciate you joining us.
Thanks,
Oh, yes,
Will.
thank you so much, Will.
Yeah, thank you for having me.
Can we get a bathroom break?
It's right around the corner. I'm definitely gonna take.
Remember, Savon, remember it's near the,
Left.
you guys. Okay, so we did pretty good.
Ready? Okay. All right, the November 3rd, 2022 licensing committee meeting of the Texas State Board of Dental Examiners will now come to order. The time is 10:10. If you're listening to the meeting on a secondary device like a computer or tablet, please mute it until it's your turn to speak. Public speakers, please mute whenever not talking. Please say your name before the verbal vote during the voting process to ensure a proper count. And I will also announce the name of board members when addressing them in the first and second motions. The mission of the Texas State Board of Dental Examiners is to protect the public health and safety and promote high quality and safe dental care by providing enforcement, licensing, peer assistance, and related information services to licensees and their patients.
Thank you, Dr. Kearse. So before I call roll, we have a caller on the line. We just want to be able to identify them so that we can get to them if they're on the agenda. Okay, so hi caller, can you just please identify yourself so we know where to get to you on the agenda?
Yes, Angelica Avina.
Okay, great. So we will bring you back to the chat whenever we get to your agenda item, which will be coming up in just a few moments, okay?
Okay, sounds good. Thank you so
All right,
much.
Thank you. Thank you so much. All right, thank you, committee. I'll go ahead and call roll if that's
Thank
okay.
you, Ms.
All right.
Yes.
Dr. George Kirsch,
Present.
Miss Laura Jones. Present. Dr. Yvonne Maldonado,
Present.
Dr. Robert McNeil,
Present.
Miss Lois Palermo,
Present.
and Dr. David Yu.
Present.
We have a quorum and everybody is accounted for.
Great. Thank you so much. Okay, committee recommendation and possible action on application for registration on nonprofit corporations authorized to hire a dentist. And I'll turn this over to Ms. Mendez, please.
Good morning, committee members. The first one, there's two nonprofit requests. The first one is the Resource Center of Dallas, Inc. Dr. LaShawn LaShaw submitted a request on behalf of the Resource Center of Dallas, Inc., DBA Resource Center for approval for registration by a nonprofit corporation authorized to hire dentists. The board staff has deferred to the licensing committee for the final outcome. In your packet there, you'll see that all the documents from the checklist have been submitted. There's a few more, just there's a little discrepancy in the name, but it had been sorted out. So it's more than normal. So you want me to wait for the second one, or do you want to just do each one?
You want to
Let's
vote
do
for
them
them
individually. Yeah, let's do them individually. That's fine. Do I hear a motion to accept?
Oh, I have a question.
Yes,
Are they here?
No, they could not attend.
neither of them.
I think the second applicant is going to be able to attend. The
Okay.
first one was not, but I didn't want it to be held against them.
Mhm.
So if you had any questions or wanted to deny it, I just asked we move it to February.
Okay, because I do have a question. I just wanted, do I ask my question now?
Sure, if we can answer it, we will.
Okay, like what percentage of HIV and AIDS patients do they see?
If you take a look at their website, it seems like that's their entire patient
Okay.
population. Yeah.
Okay, okay,
It's pretty high.
thank you.
And question.
Go ahead, Dr. Yu.
You know, for legal, they've been in operation since 1993. What is the reason why they want to ask for nonprofit registration for the board?
I believe it's because we just put out information in our newsletter about the nonprofits, and I think people just didn't know. So it was, I think it was our prompting through the newsletter.
I make a motion, we approve the request.
Okay, do I hear a second? Second by Dr. McNeil. A motion by Ms. Jones to approve. Is there any further discussion? All in favor of the motion?
Aye.
Okay, the motion carries unanimously.
Okay, the second request is coming from San Antonio Christian Dental Clinic, Inc. Ms. Gloria Conseco submitted a request on behalf of the San Antonio Christian Dental Clinic, Inc. for approval for registration by a nonprofit corporation authorized to hire dentists. In the documents there is the application. And the board staff is deferring to the committee for the outcome.
Okay,
I think
I do have a
she was
question
gonna
for
be
them if
here.
they're on.
Dr. Maldonado, go ahead, please.
Is that her?
But this is a different person. Yeah. Different person, yeah.
So a representative from this group is actually online if you want to
Okay.
speak with them, sure. And I believe her name is Miss Elliott.
No.
Oh, okay. Oh, okay.
Okay, so Ms. Conseco, this is Dr. Yvonne Maldonado, and I thank you for being here. I just had a quick question about your clinic. What is the percentage of homeless that you see in your dental clinic?
Between 40 and 60% in any given year.
Okay. All right, thank you so much.
Is that all?
Yes.
Thank you so much. And thanks to all of you for your service.
Do I hear a motion to accept? So moved by Dr. Maldonado, second by Ms. Jones. Any further discussion? All in favor of the motion? And that carries unanimously as well. Okay. Next on our agenda is committee recommendation and possible action on staff deferral to licensing committee for Dr. Chung, who is DDS 1. Ms. Mendez, would you want to take this discussion, please?
Dr. Kirsch, I'll go ahead and
Oh, okay.
address this since this is, he has some board history with another board.
Yes,
So it
yep.
went to legal to review.
Okay, thank
So
you.
this applicant submitted a dental licensure by credentials. Board staff proposed a confidential consent order pertaining to disciplinary action that he received in the state of Idaho. And the order consisted of a 5-year probated suspension and an evaluation with PRN. The details of the order are in the background section of that memo. After receiving board staff's proposed order, he hired an attorney, Mr. Dan Leip, who are both here today and would like to address the committee.
Perfect. Go ahead and step forward, please. Thank you.
All right, good morning.
Good morning.
I know we don't have a lot of time, so we just planned on each making some brief remarks.
If you can keep it to 5 minutes for each, that'd be great. Yeah.
I think we can keep it to 5 minutes total.
Total, that'd be great.
Yeah.
Yeah, thank you.
That's our goal,
Yeah.
but the idea, I guess the way we split this up is Dr. Chung is first going to introduce himself, just talk a little bit about his history. And then I'm going to come back and just talk about what we're asking from the committee, why we're asking for, and why we think it would be consistent with the board's disciplinary rules. But with that, I'll turn it over to Dr. Chung.
All right, first off, thank you for your time and consideration in this matter. Sorry, my voice is shaking a little bit. But yeah, so I've been sober since July 2014. And I've successfully completed the 5-year PRN program in the state of Idaho. So I guess it's funny, you guys were discussing the whole PRN before this, but as you all know, addiction is a disease with no known cure. And so I've learned that. And so I'm always never complacent in my recovery, always actively engaged and aware of my mental health and well-being. So in regards to, I guess just what I've learned throughout this whole process is that, I guess growing up as the firstborn, I used to have to kind of hold things together and bottle everything in. And that became very detrimental for me in my mental health while I was in Korea. So I learned that the importance of, I guess, just, communicating and leaning on your support group is very crucial, important. Fortunately for me, I do have a very strong support group, which consists of my family, friends, and sponsor. This is kind of embarrassing to admit, but I do speak to my mom every single day. Guess I'm a mama's boy. But other than that, I just, I feel like I've gone through the program of PRN and have assimilated a lot of healthy ways and outlets to deal with the everyday stressors of life. For me, that includes a lot of exercising, running, hiking, reading, learning new things. And I visited Austin many times. I fell in love with the people and the state of Texas itself. I just love the diversity and different cultures that are present in this community, and also just the warmth and kind of welcoming environment that the people have. So I've learned that Southern hospitality is a real thing. My parents are also open to relocating here once I do get established here, just because there is a larger Korean community for them. It'll be more comfortable. I currently have a job offer pending in Pflugerville at a private office. So I just hope that I can, make a positive impact in the state of Texas and able to proceed onward.
Dr. Chung, quick question for you. As your attorney has requested, y'all are seeking reprimand without PRN, but as you stated, addiction is a lifelong thing.
Mhm.
Why would you not want to do the PRN?
Just an evaluation of.
Right.
Yeah.
I mean, that's just like you stated yourself that it is an addiction for the rest of your life.
Mhm.
And in order to really protect the citizens of Texas, I think that is, I'm not going to waver on that, to be honest with you. So
Well, to answer your question,
Sure.
I've been sober for a long time, and I get it. You can always relapse. I understand that.
and you understand our position. We have to protect the public.
I do understand.
Only way to do that is to be monitored. It really is with that type of addiction.
I agree.
Go ahead. No, go ahead.
Yeah, I of course, had a few comments, and I understand, the board's position on that.
Right.
Dr. Chung does as well. I guess what we would point out is, he has been monitored in Idaho by their PRN for 5 years. He just finished that earlier this year. Has been sober since 2014, self-reported.
And I applaud you
Idaho
for
and
that,
PRN.
by the way, because it's tough. I mean, it really is tough.
And he's continuing to work his recovery program regardless of whether he's in,
Right.
PRN or not.
Yeah.
And I guess, what I would just respectfully submit is, at some point you do have to stop monitoring just based on someone's track record, history. I know the board's position is not to monitor dentists for life, if they have a situation like this.
Well, actually, we do. That's why we have a board.
Well, I mean,
it's to
through
monitor all
PRN,
dentists.
through PRN participation.
Yeah.
That's all I mean by
Yeah, and I think just an evaluation for me, PRN isn't saying he's going to be monitored.
Exactly.
Like it's an evaluation is just an evaluation to say.
Exactly. Dr. Yu.
Dan, I understand, that he had an order with Idaho and he went through what's their PRN, Southworth Associates or something like that. And he went through that and the order for the recovery program was 5 years, right? So it was 3 of 2015 or 17 and it ended 3 of 2022.
Yes.
And so he's technically off that order.
Correct.
Right. So he's a quote graduate. So, I think our board, our question is why not submit to at least an evaluation with PRN and so that they can do regular drug screening intervals, just so we're covering our bases so that we want him working.
Exactly.
But at the same time, we want to make sure that, we
We're doing
totally respect the order that was given. But keep in mind, no offense, but you had a military court martial. You took, I don't know if you took it, but they counted 400 oxycodones,
Mhm.
and so it's and you're dealing with patients. You have access to medications, easily in a practice. So that's kind of how we're looking at it from a public safety standpoint,
Exactly.
anyway.
I think speaking on that, just going through this whole experience through the PRN, I'm more aware of, and obviously just of the whole prescription of narcotic abuse problem we have in America. And I'm able to recognize that more, with patients who are seeking have drug seeking behavior, just because I was in that position.
Yeah.
So, I'm better. I feel like I became a better clinician and prescribe, because back then when I first started, I didn't know, like they were just like, oh, 15 minutes, like whatever, just 25 minutes. So that's just what I thought was standard. And now obviously I've learned, and that doesn't happen.
And just one more thing to the board's point, of course, we're respectfully requesting two things, neither of which have to be together. One was, to remove the PRN evaluation. The other was to reduce the probated suspension to either a year or a reprimand. Either one of those can be done. I agree, if he's evaluated by PRN, I think there's a good chance they're not going to want to monitor him just based on his history, or if they do, it will be for a year. And that's one of the reasons why that other aspect of what we're requesting there is, not necessarily a 5-year probated suspension, because it might not be necessary. And, if they do say the board does do a reprimand or a 1-year probated suspension, they decide, no, we want to monitor you for 5 years, that will still happen. PRN will still do that through their agreement. That won't change. And if he didn't satisfy that, he would get reported back to y'all.
I will say that we do have our modification rule that says that someone can come back within 12 months or after they completed 2/3 of their probation, whichever is longer.
Reevaluation.
So for reevaluation of the order.
Of the order.
Yeah, of the suspension period.
Dr. McNeil.
My comments on this is, there's a bunch of factors here. The recidivism rate is quite high with substance abuse. We're all sort of aware of that. You've gone on a long journey. Appreciate you telling us about it. And to Dr. Yu's point, you've got access, as dentist providers, we've got access to certain drugs that makes it a challenging situation from a public health perspective, but quite frankly, also from a licensee perspective. That's part of our obligation as a board, is to protect the public and to do things to protect you as a licensee. PRN's the group that we've contracted with and we're familiar with and said, hey, they know us, we know them.
Yep.
Let's have an evaluation. So I'll concur with my fellow board members. An evaluation by PRN certainly makes sense. Is there, our standard order here is a 5-year probated suspension? And if we have a PRN evaluation and they say no monitoring or further treatment is needed, then we still keep the 5-year probated suspension.
And one of the things we had pointed out in a written submission, I'm sure the panel has, just going through the board's disciplinary rules and matrix. And, I understand in most cases, the board does do 5-year probated suspensions. In this case, I would submit this isn't like most cases, just given the timeline and the stance we're in, where he's been sober long-term, completed a 5-year order in another state. The board's rules and disciplinary matrix doesn't actually say it has to be a 5-year order in this circumstance. And, that's why we were proposing, for instance, the 1-year order instead.
Go ahead.
Is there an opportunity for this applicant for a license to have the PRN evaluation, and depending on that evaluation, come back to us to make a request? And so if PRN evaluation finds no need for monitoring, then that may
Sway
give us
us.
the ability and
Right,
say,
right.
okay, well, maybe 5-year probated suspension may not be most appropriate. Is that a course of action that's reasonable?
Oh, I would be okay with the reprimand and a 1-year probated with PRN. No. Okay.
No, I just want to make, it's either a
It's either
reprimand or a
or.
1-year probated suspension.
Oh,
You can't have
you
both.
can't have
That-
both.
That's what
Oh,
I was.
okay.
shaking my head
Thank
at.
you, Kathy.
But that's,
Yeah.
that's just
Yeah.
what their ask was.
Right.
Right.
Versus saying, do a PRN evaluation prior to us giving a license, and that may not be possible based on our contract with PRN.
PRN. Ms. Jones.
Well, could I make a motion that we do a 1-year probated suspension with the PRN evaluation? Unless PRN comes back and says he needs to be monitored for a longer period of time,
Cassie.
and then we can.
I want to
rescind that.
just reiterate this. Dan already explained it, but I'll also hit on this again. So we'll take that because that's what you're suggesting that you may want to do. 1-year probated, PRN evaluation, right? For the sake of this argument, they recommend a 5-year monitoring agreement, okay?
PRN.
PRN, not
Okay.
us. Doesn't affect that he's gonna have a 1-year probated suspension
Right,
on his
right.
license, right?
Right.
And because he's subject to a board order that required PRN has a lot more flexibility to refer him back to us for further disciplinary action should he have an issue with them, not follow the program, but
So it could be another. issue
exactly,
in
it
the
could be
future.
another issue in the future. I think part of the problem here is being able to practice the sooner rather than later,
Right.
here, and by offering a 1-year probated, having that PRN, still having him subject, if that is the case, right?
Right.
He can get to work and go from there, and then even if he's under a 1-year probated suspension, and no PRN monitoring, we still have that 1-year monitoring as well.
Okay.
I make a motion that we offer a 1-year probated suspension with PRN evaluation.
Is there a second? Dr. McNeil seconds that. Any further discussion?
I have a question.
Uh-huh.
So there's that option, and I know that's, I'm not speaking to that motion specifically, but I just want to get some information about a 5-year probated suspension.
Lauren
what's
Is
or
that,
Cassie?
What
is that, is
specific-
that?
Is this a
what's-
question for legal?
Yes.
Okay.
Yes. So is that, what's the difference between the 1 year and the 5 years? So the
A
5-year,
longer probation period,
yes,
that's it.
okay.
Yeah.
Okay.
Dr. Kirsch,
Yes, sir.
but I think what I heard legal say is if a PRN evaluation says there is a requirement and necessity for.
We
monitoring
could come back and
years,
change it.
Then it.
Okay.
No,
No,
we can come back and make a new one.
Oh, man, no.
Make a new one.
Yeah.
He'll be monitored for 5 years. That's the recommendation. He'll be monitored for 5 years.
By
We're-
PRN.
By PRN.
Oh,
We're only monitoring him for 1
1
year. If he has a problem in PRN such that he,
At year 3.
at year 3, he has a problem with PRN, he's no longer following the recommendations, having some sort of issue, whatever it may be, but we'll say just not following the recommendations, right? PRN will report it back to us to take further disciplinary
Got
action
it.
and he'll have a
Okay.
new issue. in
Okay,
front of us.
okay,
So that's where the teeth is in that, if you do
Yeah.
a 1 year
Okay.
versus 5.
okay.
Got it.
Perfect.
And I certainly feel good about all of that.
I do too.
think it
I do
gives
too.
And there may be a-
opportunities and lets
Yeah.
us deem what we think is our.
And there may be
protocol.
a chance that PRN says, hey, you're good to go.
Exactly, exactly.
That you're, you
can
don't need
You're
to be
doing what you need
monitored.
So we just monitor for 1 year.
And I feel like the board, we need to stay in our lane because we are not psychiatrists. We can't say you're safe or not safe to practice. That's why we defer to PRN, and that's kind of where we're kind of putting our foot down on this.
All right, so Ms. Jones made a motion for a 1 year probated suspension with PRN monitoring
Evaluation.
evaluation. And Dr. McNeil seconded. Any further discussion? Okay, all in favor of this motion? Okay, the motion carries unanimously. We
thank
will
you
take
very
this to the board tomorrow.
And just a question on that. I know it goes before the full board tomorrow. I'm assuming Dr. Chung doesn't need to sign anything before that happens or.
No. Yep.
Thank you very much.
Thank
Thank
you.
you for your time. Thank you.
Thank you. Okay. Next, we have committee recommendation and possible action request for exception to board rule for RDA 1. Now, according to what I read, there's no exception to board rule on this.
Right. Can move.
So do we vote? Do we just move on?
Move on.
Okay, perfect. Thank you. All right. All right, Ms. Mendez, will you lead us in discussion in RDA 2, please? Yes.
And Dr.
And-
Kirsch will, I'll take this one as well, since
Okay.
we will review this
Okay.
applicant. She has criminal history. She received a deferred adjudication for felony offense of theft of property. And she was placed on 3 years of probation, and she currently is still on probation. So according to board rule 101.8, she is not eligible for license for a registration. And she is on the line to speak to the committee.
Okay. Angelica, are you there?
Well, we have to.
Oh, sorry. No, go ahead. Sorry. Angelica, are you there?
Yes, sir.
Okay, go ahead. You've got 5 minutes.
Okay. Hello, my name is Angelica Avina. I did apply to get my RDA license. I know what it says. Well, my background check did not come out great. I did that. I did what I did out of, it was just a big old mistake, honestly. I am trying to get my life better. I'm trying to get my license to get myself on the right track. I don't do drugs. I'm not a harm to society. I am on probation at this point, but my probation officer says I'm low risk, and even whenever I was getting on probation, the court was going to put me on 5 years, but I was already paying back what I had taken from my previous job. And since they saw that I was paying it back already, in good graces, they basically just put me on probation for 2 years. I want to say probation, I have like maybe about 1.5 years left. And then I only owe $200 of what I took from my job. So at this point, I'm just trying to get everything straight in my life. I'm trying to get my DA license. I'm trying to do better for myself in the sense of what I wasn't doing then. I was trying to find the easy way out, but now I'm trying to work hard. I'm trying to get my life straight, basically. And that is why I'm trying to get my DA license so I can better myself, I can better my future. But yeah, I'm just trying to get my DA license, and thank y'all for listening.
Thank you. Thank you, Ms. Avina.
Yes, sir.
Ms.
Okay,
Jones.
Yes, I have a quick question for you. Are you currently working? Are you currently working in a dental office right now?
I do. I work in the front desk, so
Okay.
I'm trying to move up.
So right now you're not prohibited from working.
No.
Okay.
No.
Dr. McNeil.
Question for legal or statute.
Yes.
Yes, we are.
So do I hear a motion to deny exception to board rule? So moved by Dr. Maldonado, seconded by Dr. McNeil. Is there any further discussion? Dr. Yu?
Well, and correct me if I'm wrong, the order was in just this year.
Yeah.
And the judge, granted that the judge lowered the deferred adjudication probation from 5 to 3 years, but you're still under that order.
Exactly.
So
And
Thank you.
I have a
Ms.
question.
Jones.
I have a question for legal. So if this is something that she's denied right now, because it is so fresh, so new this year, is it something in 3 years she can come back and apply again for her RDA?
Yes, once that deferred adjudication period of probation is over, whether it's 3 years or if it's a lesser sentence, an early dismissal, any termination of that, she can apply then.
Earlier.
Yes,
Okay.
yes, but the period of probation has to be completely finished.
Angelica, does that make sense to you? Can you understand what we're talking about?
Yes.
Okay.
And Angelica, just as a reminder, you can function as an assistant. Okay, you just can't do certain things.
Exactly.
Take X-ray.
That's a very good. Yeah. Or
I'm
monitor.
sorry, can you repeat that?
She asked you to.
You can function as an assistant. You just won't be able to take x-rays or monitor nitrous.
Oh, okay.
Yeah.
Okay.
Yeah, you can still be an assistant. Yeah.
Okay. Yes, sir.
Okay, so we have a motion, we have a second. Any further discussion on this motion? All in favor of the motion? Okay, the motion carries unanimously. Thank you, Angelica. And this will go to the
Okay.
full board tomorrow for vote as well. Okay,
Okay, yes, sir.
thank you.
Thank you. Have a nice day.
You too. Okay, legal or Ms. Mendez?
Ms. Mendez.
Okay, all right, Ms. Mendez, if you can take us through DDS two, Dr. Sharoff.
Yes, on July 8th, 2022, applicant submitted a dental licensure by foreign graduate application. Board staff is deferring the applicant to the licensing committee for approval of a remediation program. Dr. Sharaf submitted an application for licensure by foreign graduate on July 8, 2022, and upon review of the application and the supplemental documents, staff determined that the applicant is not eligible for licensure due to not having completed a board-approved remediation with the required number of hours. The applicant successfully completed the operative section of the REB on her fourth attempt after she completed 40 hours of remediation approved by REB. The applicant also submitted proof of 24 continuing education hours completed by taking a course in advanced restorative and endodontics review, which was offered by a board-approved provider. Dr. Sharoff is requesting that the board grant an exception to Board Rule 101.2 D13 and accept and approve the remediation taken with REB along with the CE hours so that she may obtain licensure in Texas.
And she is here if the committee would like to hear from her.
Okay. Yeah, she took a total of what, 64 hours is what I calculated. Is that right?
Yes,
Is that right, Ms. Mendez?
yes, sir.
Hey, Dr. Sharoff, welcome.
Hi, good morning.
Good morning.
Good morning, everyone. Good morning, board committee members. Thank you for giving me the time to speak today. My name is Rana Sharaf. I'm applying for my dental license with special consideration. A quick background, I graduated from the School of Dentistry back in Alexandria, Egypt in 2011, ranked 4th in my class. I never really enjoyed clinical dentistry, so after my senior year, I decided to apply for a radiology oral medicine residency in Egypt. They both are part of one department over there. In 2015, I moved to the US with my husband and applied for the oral and maxillofacial radiology residency at UT Health and Science Center in San Antonio, Texas. I completed my residency in June of 2020. I knew I was going to have to complete REB as part of the licensing process, which was a concern since I hadn't practiced any clinical dentistry in 9 years. My first attempt was in July of 2020, managed to pass all sections except for operative, which I failed 3 times. My score, however, improved at each attempt, with the third attempt being 0.02 points away from passing. I was aware that after a third failure, 80 hours of remediation would be needed. However, on May 6, 2021, I received a letter from REB stating the following, in quote, as a result of reviewing your performance, the board requires the following clock hours of remediation prior to taking the exam again, period. Operative 40, end quote.
Right. You thought that was this board.
Yes.
You didn't think it would, you, right.
Exactly.
Right. That's
So,
where the rub is. Okay.
so when I read the letter, I was under the impression that the Texas State Board evaluated my scores and accordingly asked for 40 hours of remediation only. I didn't second guess the reduction in remediation hours since I was so close to passing on the third attempt. I moved forward, completed the 40 hours at the UT Health and Science Center in San Antonio, submitted the completion certificate on time, and was granted a 4th attempt. I passed all sections on the 4th attempt. This time, the scoring was 4.04 in operative. After completing all the requirements and applying for the dental license, I received a letter from the Texas State Board stating that I did not meet the licensing criteria. When I called to get clarification, I was told that I had been misinformed by REB. Up until that moment, I was not aware that the Texas State Board of Dental Examiners had separate requirements after unsuccessful REB attempts, like, for example, the pre-approval of the remediation course, or that REB can grant a 4th attempt without the Texas State Board's approval. Regarding the hours of remediation, I would just like to relay that I had a full year to prep for the 4th attempt, so I had no intention to cut any corners. I could have completed any number of hours of remediation needed. I even completed an elective 3-day, 24-hour hands-on course in California to improve my skills. So now that I understand Texas requirements go beyond the REB requirements, I would like to ask respectfully for special consideration from the Texas State Board and the following. Would the Texas State Board be willing to accept the first 40 hours of remediation, which were completed at a CODA-approved institution, which was UT Health and Science Center in San Antonio? I am most willing to complete another 40 or 80 hours of remediation at a CODA-approved institution according to what the board decides or deems necessary. I will make sure to obtain the Texas State Board's approval for those remediation hours prior to starting the course this time. Lastly, since I've already met the rep criteria for a 4th attempt and passed, would the Texas State Board consider accepting that passing score after the completion of the remediation requirements? I have enclosed the curriculum and all the details of the remediation course I intend to complete. It will be at the UT Health and Science Center in San Antonio for your pre-approval. They have provided a 40 and an 80-hour course option depending on the board's decision. Thank you again for your time, and I'm looking forward to the board's decision. Thank you so much.
Are you going to be a practicing oral surgeon?
No.
Okay.
Just a radiologist,
Okay, just
my
radiology.
specialty, yeah.
Okay.
Are you
Yeah.
practicing right now?
No, I can't without my license.
Are you working right now?
No.
Where are you planning to work?
So there's this company, it's called Beam Readers. I am hoping I can apply very soon to that, but I can't without my license, so I have to wait.
Here's the rub too. If we do grant a license,
Mhm.
or if we do get exception, you can go and start practicing.
Mhm.
Without meeting the qualifications, really. Dr. McNeil.
On that point, I would say that you put great credence in passage of the rep examination. So she would be as confident from a, if
Can't hear you.
Speak up.
Mike.
I said, turn the microphone off. Did you turn off my mic?
Thought about this.
But so, and I hear what you're saying. We always get into, are we setting a precedent? But also
We are.
and there's a reason why we have an actual rule that says exception to board rule. Otherwise, we wouldn't have the rule for exception to board rule.
Well, no, we have rules,
Sure, we have rules.
but we have
One of those rules is that people have an opportunity to ask for something like this. When I first became a board member, our first training through the governor's office was always ask why. Why are we doing something? Certain things were certainly bound by statute, like the last case that we just dealt with, where our hands are tied. But if I look at this, sending this applicant to do more operative when you've done time, you've passed the minimal competency exam. From my perspective, I look at it and say, what are we doing for people in the state of Texas to force additional time? Now, if you look at it and say, okay, well, you did this and it wasn't pre-approved and we need a certain number of hours. What I hear you say is you're willing to do that. And maybe that meets everyone's needs, but
All right, I'm gonna play the devil's advocate, and I'm gonna say, how are we protecting the public? She hadn't practiced in 9 years. She hadn't cut on a tooth.
oh, kind sir, but we have a reb. It's been passed.
I get it.
That's
But she didn't take her 80
say,
hours
hey,
we require for her to take.
yeah, that's a piece of the pie. But if
No,
we're gonna
I'm playing devil's advocate.
totally get it,
Yeah.
and if
What's
we're
to
gonna-
keep her, we do this, what's to keep her going and opening shop and starting to practice operative dentistry and doing crowns, which she hadn't done in 9 years.
she's
how-
passed, she
How are
passed the
we
exam
protecting the public?
because she passed the
I
exam.
mean, that's our call, right? Is to protect the public. Do you want me to read the mission again?
Read it. I'm okay with that, but she passed the exam. She passed the exam,
I
and we
get-
put.
It
such
took her
strong
3 times to
reasons-
pass the exam, and she had to do a remediation,
Yeah,
which she didn't complete the remediation because she lacks
40 hours.
16 hours.
okay,
I'm just playing the devil's advocate,
totally get it. But so
Dr.
we'll-
You,
we'll do
and I
those
get your
additional
point. I
hours.
get your point.
You
And I know
can't-
she's going to be a radiologist.
You
I get
can't
that.
say the reb exam, we trust it to document competence, and you and I have had all sorts of go rounds
We have.
about
We have
the reliability and validity with that exam.
totally agree.
She's passed it.
Totally agree.
Yes.
Dr. You.
So you're basically, well, the board rule says that you need to bring up, to the board, your 80-hour course. and have board approval prior to taking the fourth attempt.
Yes.
And so that wasn't done, obviously. But my question is, you took the 40, which probably would have been approved, but we would have said, hey, you need to do 40
40
more.
A little more, yeah.
Um, But, Ms. Mendez, with that extra, what, you did an extra 24?
Yes, that was
Okay.
elective, like
CE
I,
course.
yes.
Exactly.
So the
basically,
question is
yeah.
whether that extra 24 would have also counted, and then you're missing 16, basically.
Okay.
And, I know we're doing retroactive because you
Mhm.
didn't bring it up,
Yes.
and
Right.
ask the board. So I'm just wondering how we navigate this because, obviously you passed the fourth attempt
Mhm.
and, we don't want you to have to retake it,
Yeah.
but depending on how the committee feels.
Miss Mendez.
Yeah. So Ms.
Mendez?
Mendez, what are your thoughts?
Well, my thoughts are is that the CE that she took, the 24 hours are from a provider. Our board rule says that the remediation has to be from a CODA accredited dental school.
Accredited, yeah.
Mhm.
So she's really lacking 40 hours.
40.
And her specialty is within the scope of what we accept. As far as, that's an approved specialty.
Yes.
Okay.
Yes.
And she will be practicing as a
Radiologist.
radiologist, so it's kind of, and she did pass rep, so it's kind of like we're going backwards. So that's
But again, with that license, she can go and practice
Mhm.
right,
any
It's
all
unrestricted.
phases of dentistry,
Yeah.
right? It's not limited to radiology.
but she did pass the fourth attempt. So
We're in a conundrum.
I know it's
I mean, it's
It's tough.
Couple of questions. Your last pass, was it on a mannequin or a
Mannequin.
live patient?
It was on that.
I'm thankful that it was on a mannequin, not a live patient.
why are you thankful?
Yeah.
Well, I'm thankful.
Because she could have injured somebody?
Yeah.
Yeah, well, no,
Dr. McNeil, can you speak up?
I'm being honest.
Yeah.
I keep turning off. So yes, and I think
Right.
it's inappropriate for a live patient to be exposed to potential injury. So we have this, you're a radiologist.
Mhm.
You shouldn't be prepping teeth. I'm an oral surgeon. I shouldn't be doing operative exams. If I had to get a license somewhere that was wanting me to take an operative exam, I'd be in the same situation
Yeah.
as you were. Bless you.
Bless
Your specific ask to us is you're accepting, hey, I need to take more continuing education from a CODA approved group, and you've picked out a 40-hour program. Is that
At 40 or 80, they said, they
Okay.
gave me the option of just wait for the board's decision, see what they decide and what's necessary. And based on that, we can do either.
And so hearing everything that's going on, I'd like to make a motion that we accept a 40-hour CODA approved, board approved program for licensure in this case. That is my motion.
Is she, I don't even think she's asking.
What?
Do you mean an additional 40 hours?
An additional
additional
40 or
40.
80, yeah.
You took the 24 that were
Do the 40,
technically
then come
not
back and ask the
CODA.
exception to board rule, and then I'm okay with that.
So
Or you're just saying.
my
do the
motion
40 and then
is
we grant license.
do the 40
And then we
that's
grant the
board
license.
approved and
Grant
licensure will be granted.
Second.
I agree with that. I'm okay with that.
Thank you for the second.
Is there any other discussion? Dr. McNeil?
Granting licensure to
No, we're not granting licensure. We're granting 40 hours.
After.
licensure
Approval
based
for 40
on
Approval for 40 hours.
approval for 40.
But
I was going to word it
do you
as
want her to
approval of
submit it to the
exception to
board?
board rule for candidate DDS
Yeah, I did
Say
submit
that.
the board.
two
She's
based on successful completion of board approved 40 hours remediation. Continuing.
period stop.
Period,
That's
stop, period, stop.
Can I ask for clarification on that?
Mhm.
Because with the information that was submitted, it says can be on patient or mannequin. Are we
Yes.
specifying?
Mannequin.
I'm just checking.
Again, why are we asking mannequin and not live patient? Okay, I'll shut up.
Good
Yeah,
reason.
you better shut up.
I'm gonna shut up.
Just, so the one submitted is for 80 hours.
80 or
Right.
40. The
Oh, it has an option.
I
She already
don't
did
see
40.
the. I
So,
don't
yeah.
see the 41.
Well, it was mentioned verbally, but yeah, I can always ask for a 40 instead of the 80. I don't think they'd mind, so.
So can I say something?
Yes, Ms. Mendez.
Sorry, I just wanted to clarify, if she's going to do a remediation, she would need to bring forth that information to the board in February for you guys to review and then grant. Once the remediation has been approved, then she can take it. So it would be, we're looking at after February.
Right.
So can you repeat that?
Well,
Yeah.
I
clarified
would
that,
actually
yeah.
recommend just board staff review it like you always do for that. Because I don't want to waste more of her time. Personally.
So, point of clarification.
Yeah.
I think what Ms. Mendez is saying is that because she submitted the 80-hour, we can't approve a 40-hour because we don't see that. Is that correct, Ms. Mendez?
That is correct. I was actually
right now-
requested it.
Yeah, so
Okay.
right now, the only thing we could approve is an 80-hour if you
Okay.
wanted to proceed forward.
Point of clarification. To concede to Dr. Yu's valid points there, and especially given all the circumstances we're talking about, as part of the motion, if I need to modify it to give board staff appropriate
Directive.
The ability.
direction, I think we all understand where we're going here.
Or just
And do we even
agree that we
put that in?
accept the UT San
80 hours.
Antonio.
I don't mind
as we
doing the
see
80
it.
hours of
And
that.
if it's
Right.
40 hours.
Successful
Instead of-
completion
instead
of the
waiting
40-hour.
until February.
Yeah, I can do
program.
that. I
Right.
don't mind.
Yeah, she can go do her 80 hours.
Yeah,
I feel a lot
Right.
more
Yeah.
better with that.
yeah.
Yeah.
She's saying that she would.
She
do
said
the
Yeah.
80.
So let's just do the
The
80
one she
You
has.
like
and then just move forward. And then she's done. She submits it, she gets her
2
license.
weeks.
Right.
Do you want to take?
So
the
in
motion?
that case, I don't need to submit the course now. It's gonna,
This is
yeah,
what
like,
was
this is
submitted.
for the
You
pre-approval.
just
from the
submitted and
board.
we're gonna approve
Yeah,
it.
so this is,
Right.
okay.
That
So there's no-
expedites everything. You take your 80
Okay.
hours
Yeah.
and you file for your licenses and you'll get it.
Okay.
There you go.
Everybody good with that?
We'd have to amend.
Will you
Yes,
amend your
the
motion, Dr. McNeil?
I will withdraw my motion, but a lot of this is moderately ridiculous in some sense, but I think this will get you to a pathway of licensure in an expedited way doing what we're talking about. And I thank you for kind of being agreeable and forthright
Absolutely, of
with
course.
your situation. So I'll withdraw the motion. Or I guess I amend it
Just amend it to 80 hours,
80 hours.
Yeah. which is approved now.
Which is,
The one that we have.
That's all you gotta do is amend it from 40 to 80.
we'll go up to 80.
Okay. It's been seconded by
seconded.
Ms. Jones. Any further discussion? All in,
Wait.
oh,
Sorry, but board staff does have the authority now, once she submits that she's finished her remediation course,
Oh,
to
yeah.
go ahead and
Grant
issue the license.
yes,
Thank you.
yes, they do.
Clarify.
Yes,
Okay.
yeah.
Question too.
yes, they do. Yes.
Because that's part of your motion.
That
Right.
was part of his
Yes.
motion. Yes.
Yes.
Yeah.
And are there any, like, is it mannequin? Is that?
Mannequin's
does that
fine.
Work for you? Okay.
Yes, mannequin's
Just
fine.
checking. Okay.
To the cat, you said.
Okay, any further discussion? All in favor of this motion? Okay, the motion carries unanimously.
Hey, thank you so much.
You're very welcome.
Thank you very much.
Good luck to you.
Thank
I'm happy with that. That's good. Okay, Ms. Mendez, DDS 3, Dr. Neil, how do you say his last name? Sign.
Fine.
Sing.
What does
Sing.
say sign? Sing.
Sing.
Okay.
Okay.
Board staff is deferring the applicant to the licensing committee for a request for exception to board rules. Dr. Neil Sine submitted an application for licensure by credentials on August 2nd, 2022. Upon review of the application and its supplemental documents, staff determined the applicant is not eligible for licensure due to not having been practicing for at least 3 out of the 5 years in another state or territory of the U.S. Dr. Sign has been in an orthodontic residency for the last 2 years where a stipend was not received. Dr. Sign has submitted a request for an exception to Board Rule 101.3 and is now requesting that the committee accept the proof of practice from the program director without the proof of a received stipend. And so just to clarify, the proof of practice is actually the affidavit that's in his application.
Right.
It's actually signed by the program director.
Yeah.
And so board staff are defer the judgment to the committee.
Is Dr. Singh here? Is he? No, no. Okay.
I had some questions.
All right. Do I hear a motion to deny exception to board rule?
She was here.
Yeah. Christine, he didn't indicate that he was gonna call in today?
No,
Okay.
no.
Can I make a motion to deny exception to board rule? Am I allowed to as chairman or?
Yeah.
I'm gonna go ahead and make a motion to deny exception to board rule.
And I'll second it so we can have discussion.
Perfect. And seconded by Ms. Jones. Okay, Dr. McNeil, discussion?
And so question for Ms. Mendez, the issue here is just the fact of not being able to count the 2 years of the residency program as being an active practice to fulfill our obligation of 3 out of the past 5 years.
So I'm going to say yes and no. At the direction of the board, maybe in 2018. So prior to 2018, we weren't accepting proof of residency as active proof of practice for licensure by credentials. But then after 2018, at the direction of the board, we went ahead and changed some of our processes. And if they were receiving a stipend, meaning pay for their work, we were accepting the residency. And so in this case, Dr. Sign is saying that he received some form of payment, but didn't feel that he had to submit that proof to us.
I'd look for it. I couldn't find it
What is
anywhere.
these check? What are the checks that we do have?
I was looking at that and I was like, I think maybe he sent those to Lauren, maybe those went to a vet because legal contacts the applicants once we get closer to the committee, just to make sure, they're fully aware that this hearing or this meeting will be happening.
Dr. McNeil.
And so a subsequent question, just so I'm clear here, we have dental licenses in California, District of Columbia, Florida, New Jersey, New York, and Pennsylvania.
Many lists.
And no disciplinary actions in any of those
Correct.
we're aware of. Gotcha. And then some orthodontic residencies during their training, it's just done on mannequins exclusively and not patients. And I'm being facetious there. This is in a residency, you're seeing patients, you're actively engaged during that time. So from my perspective, I'm going to vote against this motion. Just, getting back to why are we doing what we're doing? We've got multiple licenses in different states. I've been in a residency program. Dr. Yu just waved his hand. He's been in a residency program.
No,
I
he's
think
waving
he was
to
probably
mannequin.
actively engaged.
Yeah.
It was mannequin. Less bleeding with perio there. But whether you get paid or not getting paid, there were times in my residency that I was not paid and I still saw a whole lot of patients. And then there were times that I was paid, and it was just a nuance of the institution.
Dr. You had a question?
Well, and to Dr. McNeil's point, I feel like what we're doing is punishing or, almost like punishing the people that want to improve their dental skills because they're trying to go into a residency, whether it's paid or not. They're actively seeing patients. They're treating kids, and in this case, and they're actually doing something hands-on clinically that they would probably get more experience, in a residency than even all of us, So I feel like we're kind of punishing them. And I know it opens things up, like for a perio resident that never got paid and we're basically allowing them to have a license, but I think that's a good thing. I think we shouldn't punish those people that are trying to improve themselves and becoming a specialist, and not giving them a license because it doesn't count during residency.
Ms. Joe, Cassie?
I hate to be the statute police on this, but this is just a reminder that the statute specifically states that dental residents are not performing the practice.
Practice of dentistry. Thank
So
you.
that's why this is always a conversation.
Always.
We've tried to find ways around it.
And the payment.
The
Which is
payment
a
was
way
one of
Would-
those ways where
One of the
maybe
ways.
there's some.
There are working in there before getting paid.
Right.
Yes,
Right, but
Exactly.
just as a reminder,
Exactly.
resident is not the practice.
that's why we have the
industry,
rules
So
in place.
it's a statutory change based
Just a
on what
shortcut.
Dr. Yu is saying. We're a little bit hamstrung here unless you
Yeah.
want to grant the exception.
Thank you. Ms. Jones and then Dr. Mullen.
So I completely see what you're saying, Ms. Kemp, but I was thinking too, that we haven't even specified how much they should be getting paid, right? Like they could be paid $10, whatever. So, and he has now submitted proof of payment. So Ms. Mendez, would that then change the perspective or?
So what we have normally asked for and I have received is a contract. A contract of set amount, the amount, I mean, no, the amount doesn't matter.
20,000,
Right.
whatever, it doesn't matter. Yeah.
Right, and it's a contract from the school, the university, the program to the applicant regarding the receiving the stipend and the work.
So what has been submitted then from the Jacksonville University, does that comply with what you're looking for? And then the pay stubs?
I honestly, is the first time I'm looking at it and I would want to review it with one of my teams, but if the board is fine with it,
Yeah, but checks.
Does he have a contract?
Well, it's
No,
this, it's this,
It's just a letter.
like
though.
the
Yeah.
resident application and
Yeah.
then what he received as far as payment.
Just a point of clarification. I'm no attorney. If I write a check to someone for something, is that some sort of contractual? I thought it was.
No.
Just a payment? It's not a written.
You can write me a check and it's not contractual for anything. You're just.
You can have
handing me
verbal
money.
contracts, exchange things.
It could just be a refund for all we know.
You know, I think if we have proof of payroll, this person's getting paid, which fulfills the obligation per statute, I'd be pretty agreeable to that. We're moving chairs around.
But
Ms. Kemp,
I had to go back and look at a memo that I wrote last year regarding this very topic on stipends. Yes. And so
you remember?
the statute doesn't say anything specifically about payments to dental resident, right? There's a separate section of the statute that says, it has some verbiage in there about, it's not the practice of dentistry if they're a student and they're only being paid nominal amount. That's separate from the one that specifically says that dental residents are not practicing dentistry, right? So I know we're getting down in the weeds and was there a contract? Did they pay, et cetera, et cetera, et cetera? I believe following this memo, and I could be wrong, I may need to go back and look at the minutes from this particular meeting in June 2021. The board decided to take no action and just take the memo as consideration and consider these on a case-by-case basis and not necessarily take the fact that the person was paid as the
Better not.
as an ultimate board policy that yes, we are going to give or count it as practice. If I'm remembering correct.
Dr. Yu,
Ms. Mendez, he passed his CDCA exam in 2017. And with our new extension, so to speak, I mean, could he technically apply for licensure by exam?
So I'm looking at him passing the exam in 2011.
Oh, 2011.
Yes,
Yeah.
sir.
No, I, I see what you're talking about, the CDCA of 5 of 17. in Florida.
What year was that?
Five,
No,
five,
but
six,
the month,
17. May 17.
May,
So it's over 5 years now.
right.
But
Yeah,
now.
he can still apply
Seven.
by.
If we
Is it six-
Depending on what we do,
No, because, oh, if we changed it to 7 years, did we change?
We
it?
did change it.
Not yet.
yeah.
We did?
Yeah.
Oh, yeah.
but
I thought
not,
the last
not
meeting
voted.
tomorrow. Oh, I
Ms.
totally.
Camp.
Tomorrow.
That was the point.
After tomorrow.
So he could,
Not yet in effect.
so he could
Okay.
resubmit this
Technically,
After.
after tomorrow.
Not
Yep.
after tomorrow, because the rule won't be in effect immediately, but. you can potentially-
Or you could
Ms.
take that under consideration that
Right.
that if the committee is heading towards adopting the rule, and this is pretty close to the effective date of the adoption of the rule, kind of take all that into consideration as far as whether to approve them.
Offered it as mitigation.
Yeah.
Right.
Okay.
Point of clarification. Mr. Chairman.
Yes, sir. Yes, sir. I'm making my notes for tomorrow's discussion. So I know we're
A
gonna.
question for legal here. Are you saying for us to, we would be in a position to grant exception to board rule or licensure by credentials based on the fact that they could be
Apply.
applying for initial licensure by examination? Is that what you said? Or
Yes, that's exactly what.
You have
this
to-
does.
That's what I heard.
Yeah.
That's what I heard.
Kind of.
Yes.
And you know, once again, why are we
About it
doing
for a
what we're
minute, yeah.
All right,
doing?
I withdraw my motion to deny.
Okay,
I make a motion to approve.
second.
Any further discussion?
No.
what just happened? Okay.
Okay, are we gonna, yes, I do have discussion. Is that note gonna be in there? Because I think that's important.
They're gonna have to
He didn't-
resubmit. Right?
Okay, he has to reapply.
Not based
for
on the
licensure.
motion that we have on the.
That's what
table
I'm
right
saying.
Well,
You
It's
have to-
been withdrawn, so now you
Right.
can create a new
The
motion.
new
Yeah,
motion.
Why don't you?
I did.
Oh, you did already? Oh, I'm
Well,
sorry.
she did, she created to approve.
To
Let's,
approve
let's approve with him resubmitting by licensure,
by
Once,
examination.
by examination, I'm sorry, not credential. Yeah,
Does
by
it
examination.
require-
Was
once,
that the intent of your motion?
no, I don't think so.
You know, my intent was more after a conversation from Ms. Studdard, like he would qualify based on these. And so
But he hasn't applied that.
If
in
he
that-
I
applies.
think we need to.
Right.
He has
deny.
not
By
applied,
licensure by exam.
right?
Yeah,
He
I
would need to apply by licensure. by
What I,
I don't think it needs a vote, but we need to deny it so that he, on his own, apply for licensure by exam.
question,
But we could just give him guidance that, hey, you could do this.
Ms. Mendez. Okay, Ms. Mendez.
yeah, Ms. Mendez,
Yes.
How, is it easy to just transfer over this application to licensure by exam?
So no, this
Okay.
application, applicants are advised that just because they're requesting an exception to board rule, that doesn't guarantee a license is going to be issued and the fees are non-refundable. So if this application is denied, it's closed, it's withdrawn. And if you all, what I'm hearing is you guys want him to apply by examination. And then you will grant that license by exception because he's over the 5 years or see what
If it
happens.
changes
it'll be 7
tomorrow.
if it changes tomorrow.
Then it would be fine.
Okay.
What was the fee
Confused.
for each of those applications?
So the credentials fee is I believe it's $2,945. And the licensure by examination fee is $360.
Mhm.
Small price to pay to practice in
Absolutely.
Texas.
And,
Well worth it.
Go ahead.
and so if this is denied, would he be advised to apply by examination, or does he need to figure that out on his own?
We can recommend it.
Yeah, we can.
We can recommend that, right?
Okay,
Ms. Mendez, we can recommend that?
Yes, you can recommend that.
Okay,
okay.
all right. I remake my motion to deny.
We still
exception
have a
to rule.
motion on the table.
Oh, yeah, we have the
floor.
other.
Okay.
And one further, if I can, discussion on the
Yes,
motion
sir.
that's on the table, and I think your motion, and correct me if I'm wrong, was to grant exception to board rule for this. And my comment on that is we're having this person basically resubmit everything again under a new application. I would be comfortable with exception to board rule with the caveat that they would qualify based on
Licensure by
anticipated
examination.
passing of this rule, as long as it doesn't cause a nightmare on the licensing side of the equation. We're just making more work for the agency. We're making more work for the license. of something. This person has 5 licenses in different states. Why are we doing what we're doing? As long as legal doesn't think that this is an absolute disaster, we're
Yes.
doing something that is
Right.
utilizing everybody's time and energy
Yeah,
in an
and we
efficient
would
way.
already grant it.
Yeah.
Right.
And as long as it's not setting a precedent with that verbiage.
That's,
With
as long
that,
as we have
yeah.
that verbiage on that motion, I'm fine with
Yeah.
that. Because we are opening ourselves up for precedent.
Yes.
So I
mean, we
concur
are.
that that's
Well,
the
you granted
verbiage I
this guy that.
intended. for the-
Exactly.
Okay. And I still second your motion.
Okay, so can,
Poor Wendy.
Yeah.
this is your motion, Lori.
Okay, I make a motion to accept the exception to board rules for licensure by credentials with the intent that this person could be, could receive a licensure by examination
Due to tomorrow's.
due to potential board action,
Anticipated.
anticipated board action.
Board rule
Or
change.
even then, I mean, we've been known to grant a little bit of leeway.
leeway.
I mean, this is
Yeah,
6-month
was
leeway,
nice,
which is
yeah.
not bad, but
This makes sense.
Mhm.
yeah. Okay.
And just to appease the committee's concerns about any type of precedents this may be setting, we would always bring these to you. If when in doubt, we bring it to the committee. So
All right.
I do have one question,
Yes, Miss Palermo.
because I can't quite follow what Dr. Singh is doing. Why is he skipping around everywhere getting licenses in this country?
Not
That was
sure.
my question I wanted to
Yeah,
ask him.
that's,
You know,
we can't ask him that.
Because he's not here, right?
Right.
right.
But he's allowed to.
And just to answer that question,
Right.
I think a lot of people want to have different
They can,
opportunities. You know, it's a different time right now and people don't know where they're going to end up. And that's part of the benefit of the dental licensure compact.
Throw that in there.
And he did.
Well, it just looked like each one of them was one step ahead of the other one expiring.
Mm.
And I don't know, it just looked odd.
Make a
But that's just me.
You know, go somewhere else next year.
Okay, so we have a motion. This is discussion, right? So we just,
Yes.
if whenever you're ready, you we can vote.
Dr. McNeil. Any further discussion? Okay, all in favor of this motion, raise your hand. I was hesitant to.
Yeah.
All right, the motion carries unanimously. We'll bring it to the board tomorrow. And I'll talk about it.
Thank you.
All right, Ms. Mendez. Oh, boy, here we
Okay.
go.
DDS four.
DDS4.
Board staff is deferring the applicant to the licensing committee for a request for exception to board rules. Dr. Veer Pan submitted an application for licensure by credentials on August 24th, 2022. Upon review of the application and its supplemental documents, staff determined that the applicant is not eligible for licensure due to not practicing for at least 3 out of the 5 years in another state, territory of the U.S. Dr. Veerpan has been practicing in Canada for the last 6 years. Dr. Veerpan has submitted a request for an exception to Board Rule 101.3 and is now requesting that the committee accept proof of practice from Canada.
I have a.
Yeah, is Dr. Verapan here?
Oh.
Cannon, yeah, can you let him in, please? Dr. Verapan?
Thanks a second.
Oh, sorry.
Got a prompt, you want to activate your audios.
Oh, okay, got it.
Okay, now it's audio active.
Dr. Verapan, hey, welcome to the meeting.
Hi, good morning. Thanks for letting me in.
Yeah, good morning.
Yeah, I'm Dr. Cannon Veerapan. I did my DDS in NYU College of Dentistry and did my board exams there, and then passed my NERBAR CDCA, and then was eligible to apply for the Texas license then. So then I moved to Canada to practice dentistry because I am a Canadian resident and I had my parents to take care of. And now because of family reasons, I had to move back to Texas. So I'm applying for my license here in Texas. Yeah, but I thought I did all the necessary steps to get the license. I want you guys to help me carry on with my dentistry here.
Okay. You graduated in 2011
Yes, from NYU. Yes.
and passed your exams there. Okay. And then went to Canada. So the last 3 to 5 years you've been practicing in Canada?
Yes.
Is that correct? Okay. Dr. McNeil and Dr. Maldonado.
Hi, thank you for joining us. Question, are you in Texas now? Have you relocated to Texas?
Yes, yes. My wife has been working here for the last 1 year, so I had to sell my practice and move to Texas to take care of her and our kids.
Gotcha. And you have an active dental license in Colorado?
Yes.
Okay. Did you ever practice in Colorado?
No, I haven't.
Okay.
Dr. Maldonado?
I have a question for the attorneys. Is this something that's in statute
Yes, it is.
that's the rule that we need to follow?
We had this discussion.
Yes, last
but-
time.
Yeah, last time. Yeah. Yeah.
And maybe you can explain it to him. Or what's in statute. Can you explain it to all of us? Yes.
Maybe Miss Mendez can too.
Oh, okay.
She's like, no, thank you.
So Ms. Mendez,
You can
before
also-
we, can I make?
Yes.
Yeah, you go
Okay,
ahead.
so this is another case where he could potentially take, I mean, his nerves was taken in 2011, but he could potentially apply as licensure by examination if he took the
We took it again.
REB or CDCA. Is that
Correct.
an option? Okay. Yeah.
And he can also apply for temporary licensure by credentials if he wants to work for a nonprofit organization and get the 3 years of practice.
So if he had practiced within the last 5 years anywhere in the United States, we could grant licensure. Is that correct?
That's correct.
Yeah. Okay.
He could also teach, correct?
Yes, he could. Yep.
Yeah, faculty license for 3 years,
Yeah.
and then you can get your license.
Yep.
Yeah, to clarify, the specific territory is board rule. It's not, the statute says for at least 3 years preceding the date of application, or 3 of 5, right?
3 to 5.
Under this section. Does not say anything about a territory. The United States.
Canada
territory.
doesn't count?
It's.
I'm saying.
Hockey player has
defending.
stood up. Not to get checked.
We can put him in the penalty box.
Yeah.
Been there many a time.
So, no, my point is, you were asking if it's in statute that it has to be in the United States or a territory. The answer is no. It's a board rule that it has to be
Okay.
in a certain locale, which is why you can grant the exception.
Okay.
Okay. That makes sense.
Dr. Kirsch, I have a question.
Yep. Yes, sir, please.
When is the last time you practiced dentistry? Roughly.
Me?
Yes, sir.
Last month. Till last month, I had my own practice. I just had to sell it and move here.
Okay, so you've only been in Texas for a month?
Yes, since July, end of July.
And your wife came down here to work and then been kind of going back and forth to
No.
Canada?
No, we are staying here.
Okay, so
My kid goes to school here.
I thought for some reason 1 year time period that I heard before.
She's been here for a year. I had to sell my practice, so it took a little longer for me to relocate here.
Okay.
Ms. Palermo.
Ms. Palermo?
Yes, I was wanting to know, did we grant an exception to this type of thing at the last meeting?
No, we didn't. We did not.
It seemed like we had a hygienist that was working in Jamaica or somewhere, and the guy that owned the practice had
Yeah.
one in New York as well.
Yeah.
Did we not grant her
No.
and
You did-
accept you to this?
No.
No.
But wait, if they practice in Puerto Rico, for instance, would that
That would
count?
be
Yes,
a US.
'cause
That would
it's their
count,
That's
territory.
US territory, yeah.
But Jamaica doesn't.
Last time it was the
Cayman
Cayman Islands,
Oh, Cayman.
and then
Yeah.
we had two applicants.
We
that
did,
had that,
Cayman
and I don't
Islands
remember where the
and-
other one was.
The other one was
Canada.
Canada, it was
Yeah.
Canada. Canada, yeah. Okay, do I hear a motion to deny exception to board rule?
Yes.
Dr. Maldonado, do I have a second? I'll second that. Did you hear that, Wendy? Okay. Any discussion, Dr. McNeil?
Yes, I intend to vote against the motion on the table.
Of course.
Just from the standpoint, why are we doing what we're doing here? And, mobility of spouses getting transferred, that's an issue. I hate to bring up dental licensure compact, but it's going to continue to kind of be an issue. This is someone who's trained in the States, had passed the initial licensure thing, has no disciplinary complaints from Canada, was granted. a
Why,
license.
why do we have rules? That, I mean,
Exactly.
Why do we have exception?
I mean, why do we have these rules?
Why do we have exception to board rule for cases where it makes sense?
Yeah, but
We-
why do we have rules? Let's just
we
throw it all out
Yeah.
and let everybody come practice.
Well, we should get rid of the exception to board.
I mean,
Well,
If-
he could
if-
just.
I agree.
take- he could
I
just take-
agree.
He
I
could just
totally
take
agree.
Reb, the CDCA and license.
I mean, he has
Or
other
other
ways
avenues
to get,
for
right,
Yeah,
there's
so
other
it's-
avenues
don't
to
feel
get
bad
licensure.
about it. It's like,
Yeah.
he still has a path.
And that was my point as well.
Yeah.
This is a rule and we need to follow the rules. And it's not because, we agree or disagree.
Right.
We have rules that we need to follow, and that's why I made the motion.
It's not the United States of Canada.
Wow.
There's a lot of factors at the end of the day here.
Love you, man.
Why are we doing what we're doing?
Any other discussion?
Against.
Well, and just as a reminder, we're never telling an applicant no. We're just saying not the avenue you've chosen.
Exactly.
There's always other avenues for licensure.
Thank you. Thank you for Mr. Nichols for clarifying that. That's-
And like your
think
point.
the dentist
he
has a
can
comment
apply
there.
through, he can
Yep.
go work
Okay.
at a dental school. He can go work at a nonprofit.
Right.
Dr.
hygiene
Virapan?
School, yes.
Yeah.
So, yeah, all my friends, like half of my friends are working in Texas. I did the same thing. I took the same exam, same course. Is there an exception that I could get, please, so that I can practice here now that like the family's settled? I don't know where to go from here. Should I go back to Colorado, work for 3 years or 5 years and come back? Like,
That would be a great avenue for you to take. Yeah.
right, like 3-5 years, I have to be without my family, and then
And, or you can also go work at a dental school here in Texas, or for 3 years, I believe.
Teach. Uh-huh.
And you could teach, or you could go work for a nonprofit for 3 years and then reapply for your license. So you wouldn't have to leave.
Or take the exam.
Or take
Or
the exam.
retake one of the licensure exams.
Yeah.
or could I apply as a dentist, apply for dental license by exams? Would that be okay? But it's more than 5 years though.
Yeah, you could
Yeah,
take
you
an
would have to take-
exam.
You would
Yeah.
have to take the exam again.
You'd have to take the
to go
exam
for
again.
that.
Yeah,
Mhm.
Because it's been too long.
right.
But it would be a quicker avenue.
And since you've been practicing, you could pass
Should
it
be fine.
pretty
It's all mannequin,
quick.
pretty much.
It's all mannequin.
It's easy now.
Dr. McNeil, did you have another comment?
I just wanted to make sure that the candidate realized they'd be able to take CDCA Rep CETA, for instance. You
Mhm.
pass that exam, you apply licensure by examination, and you'd get a dental license.
Exactly.
You could also apply, or CERTA.
Or CERTA.
Or sorta.
Okay, so we have a motion to deny exception to board rule, seconded by me, made by Dr. Maldonado. Any further discussion? All in favor of that motion? Ms. Palermo, okay, so we have 1, 2, 3, 4 in favor of, and Dr. McNeil?
Deny.
Deny, okay. All right,
Oh,
so
not
the motion carries
Against.
forward.
5.
Okay,
1, 2,
against,
3,
you're
4,
against. not
5
deny.
for the
Yes.
motion, 1 against.
Yes,
Yeah.
yes.
1, okay. Okay,
Yeah.
yeah, thank you.
Thank
Thank you
you.
very much.
And this will be taken before the board tomorrow.
Exactly, thank you. Man, we are running way behind. All right, number 6, committee recommendation and possible action on currently proposed rule from the August 12th, 2022 board meeting, 22 Texas Administrative Code 101.2, the dental licensure by examination, published in the September 30th, 2022 issue of the Texas Register. Ms. Stutter, would you lead us in this discussion, please?
Yes.
And if you can just continue the other ones too, because it's
Okay.
the same thing, right?
Yes, so
Yeah.
all these rules on the agenda were proposed at the last board meeting. They're now up for adoption. They have been through the Regulatory Compliance Division for review. The division approved the rules to adopt. And so 101.2 specifically, the amendment was to update that clinical exams must use live patients or hands-on simulations, to update the name of CDCA, REV, and CETA, to update the name change of CERTA, and it also changes the time period the board will accept examination results from 5 to 7 years. TDA did submit one comment, which is in support of adoption of the rule, which is in your materials. And also the committee asked the board staff to do a little research on other states and what they accept, their deadlines are for accepting examination results. And you'll see that chart in your materials.
Okay. This does not need to be voted on, does it? I mean, it does.
Yes.
Oh, it does.
Yes.
Out of committee. Okay. Do I hear a motion to accept? So moved by Dr. McNeil, seconded by Dr. Maldonado. Any further discussion on this? On 101.2? Okay, all in favor of the motion? It carries unanimously. Okay. Okay, Ms. Studdard, 101.3, it's the same.
Yes, 101.3 regarding the dental licensure by credentials is to update the language to clarify that clinical exams must use live patients or hands-on simulations. TDA did provide a written comment in your materials, and so board staff is now requesting the committee recommend to adopt.
Ms. Jones makes a motion to accept.
Yvonne Maldonado.
Yeah, Dr. Maldonado, sorry. Seconds, any further discussion? Dr. McNeil?
You know, in the next couple of years, this will muddy the waters, and I'm not going to oppose this for licensure by credentials, but not to bring up the dental licensure compact again. It is going to be
Bet you are.
a thing, but I will.
It is-
It will put us in a bind where we have someone that's had a license for
And didn't take.
10 years,
didn't
didn't
take
take
it.
an initial
Right.
clinical licensure exam with live patient or mannequin.
Wow.
And this rule will say, no, you're not going to practice, but I've had a license for 12 years in Colorado.
Yeah.
You're telling me I'm not? So there'll be unintended consequences. Licensure is going to change a whole lot in the next couple of years.
And I think
So-
we'll definitely have to look at our rules. when it
Yeah.
comes to-
Once compact gets approved, if it gets
Yeah.
approved, yeah.
Yeah.
Which 15
So that's my
20
only
years down the
comment.
road.
I'm still
Yeah,
going to vote
exactly.
in favor of.
We'll deal with
what
that
we're
then.
doing.
Oh, y'all will.
Yeah.
Y'all will.
Like, geez.
Okay, any further discussion on this motion? All in favor of the motion? Okay. And it carries unanimously. All right. 103.2,
103.2 regarding licensure by exam for dental hygienists, same changes, updates language to clarify that clinical exams must use live patients or hands-on simulations, updates the CDCA REB CETA name and the CERTA name, and the time period of when the board will accept examination results. There was an error at the proposal level of the rule. The Southern Regional Testing Agency was still remained in the rule. And so staff is requesting that the committee recommends to adopt the rule with the change to the proposed text, specifically removal of Southern Regional Testing Agency.
Not removal, but the change of.
The
Change.
change of name.
Change.
Okay, I was like, wait a minute.
Yes.
all right, do I hear a motion? So moved by Ms. Jones, seconded by Dr. McNeil. Any further discussion on rule 103.2 dental hygiene licensure by examination? Okay, all in favor? Motion carries unanimously. And our last 103.3
103.3 concerns dental hygiene licensure by credentials, updates language to reflect that clinical exams must use live patients or hands-on simulations. No comments were received for this rule.
Do I hear a motion to accept this? So moved by Dr. McNeil, seconded by Ms. Jones. Any discussion? All in favor? Motion carries unanimously. Thank you, Ms. Palermo. Okay. Okay, do we have any public comments? Do I see a motion to adjourn? So moved by Dr. McNeil, seconded by Dr. Maldonado. All in favor of adjournment? All right, the meeting is adjourned. It is 11:35. That's how you run the licensing.
You
did it.
Sprint at the end.
Okay, it's unmuted, it's live.
The November 3rd, 2022 Dental Practice Committee meeting of the Texas State Board of Dental Examiners will now come to order. The time is 11:45. I just want to remind you, if you're listening on a remote device, please mute it until it's your turn to speak. And please announce your name before any voting, or I will repeat them as well when we do. The mission of the Texas State Board of Dental Examiners is to protect the public health, safety, and promote high quality and safe dental care by providing enforcement, licensing, peer assistance, and related information services to licensees and their patients. Ms. Nichols, please call roll and confirm we have a quorum for the meeting.
Yes, sir. Dr. Linda Burke is absent. Dr. Yvonne Maldonado.
Present.
Dr. Brian Henderson.
Present.
Ms. Lois Palermo.
Present.
Ms. Catherine Sisk is absent. And Dr. David Yu.
Present.
We have a quorum. Thank you so much.
Thank you so much, Ms. Nichols. And welcome to committee members for a little bit of quick agenda. Our recommendation, possible action on 22 Texas Administrative Code 114.1, the permitted duties of dental assistants. I'd like to call on Ms. Studdard. If you would, please lead us in this discussion.
Sure. So this is a simple amendment. It's to update the language with the applicable section of the TPA. Specifically Texas Occupation Code section 265.005 was repealed and the applicable section is currently section 265.001.
Thank you, Ms. Studdard. Committee members, any comments, discussion? Do we have a motion to accept agency's proposed rule change to 114.1? Ms. Palermo.
I so move.
Thank you. We have a motion to adopt by Ms. Palermo.
I'll second it.
Second by Dr. Maldonado. Thank you, committee members. Any discussion? Seeing none, I'd like to call roll call, please, for vote. Ms. Palermo.
4.
Thank you. Dr. Maldonado.
4.
Dr. Yu.
4.
Dr. Henderson's 4 as well. Motion passes unanimously. Thank you, committee. Next on our agenda is a possible action on 22 Texas Administration Code 114.6, general qualification for registration and or certification of dental assistants. Ms. Studdard, would you please lead the discussion on this rule change as well?
Yes, so the same change here regarding the updated statute section. We're changing it from 265.005 to 265.001. And it's also removing some duplicative language from 101.8 or language from 101.8 that's no longer in effect. So let's just clean it up to make it more clear.
Thank you, Ms. Studdard. Do I have a motion to adopt agency's proposed rule of 114.6? Dr. Maldonado.
Yes. I would like to, I'm for adopting this rule. Sorry.
Thank you. There's a motion to adopt. Is there a second? Ms. Palermo.
Second.
Thank you. Any discussion by committee members? Seeing none, I'd like a roll call vote for 114.6 adoption as proposed by agency. Ms. Palermo.
4.
Dr. Maldonado.
4.
Dr. Yu.
4.
Dr. Henderson's 4 as well. Motion passes unanimously out of committee to adopt 114.6 as proposed. Next on our agenda item is possible action on 22 Texas Administration Code 114.21, requirements for dental assistant registration courses and examinations. Ms. Studdard, would you please lead discussion on this rule change as well?
Yes, the proposed amendment updates the language or removes the language pertaining to Dental Assistant Advisory Committee because this committee is no longer required by the DPA and the board does not currently have a need for the committee.
Thank you, Ms. Studdard. Do we have a motion from committee to adopt the rule as proposed? Dr. Maldonado.
I'd like to bring the motion to adopt this rule as proposed.
Thank you, Dr. Maldonado. Is there a second? Ms. Palermo. Thank you.
Second.
Thank you, We have a motion to adopt and a second by Ms. Palermo of 114.21 as proposed by the agency. Roll call, any discussion?
Well,
committee members?
just a clarification for legal, the presiding officer still has the ability to create an ad hoc
Yes.
committee as needed.
That's correct.
Correct.
Thank you.
Any discussion on proposed rule 114.21? Seeing none by committee members, a roll call vote. Ms. Palermo,
4,
Dr. Maldonado,
4.
Dr. Yu,
4,
Dr. Henderson's 4 as well. Motion passes unanimously for adopting 114.21. And for clarification, these will be published and to be adopted later.
At the next board.
Thank you so much. Next on our committee agenda, as possible action on 22 Texas Administration Code of 115.2, permitted duties of a dental hygienist. Ms. Studdard, would you please lead us in this discussion as well?
Yes, the rule updates, it updates the language to reflect that the board no longer issues certificates to dental hygienists to apply fissure sealants or to monitor nitrous oxide.
Thank you, Ms. Studdard. Is there a motion to approve 115.2 as proposed by agency? Dr. Maldonado. Approved.
I bring forth this motion to approve this motion.
Thank you. Is there a second? Ms. Palermo. Thank you, Ms. Palermo. There is a motion to approve and second by Ms. Palermo, 115.2. Discussion, committee members.
Yes, I just want to clarify, what is it that you said about that hygienists do not need a nitrous oxide certificate?
Right, we don't
Any
issue
longer.
the certificates, but they're still required to have the training and
training,
education to do that.
Okay.
Yeah.
Thank you.
And it's an endorsement now.
Okay.
right? It's similar to what is true for registered dental assistants.
Very similar to what we have as far as anesthesia permits on our license. It just says more of a
Similar.
clarification.
Okay.
Any further discussion on this 115.2? Seeing none, roll call vote to adopt 115.2. Ms. Palermo,
4,
Dr. Maldonado,
4.
Dr. Yu,
4,
Dr. Henderson's 4 as well. Motion passes unanimously. Thank you, committee members. Do we have any public comments?
None.
Thank you. Seeing none, do we have any announcements the committee would like to make? Well, I'd like to make an announcement. I sure miss Miss Palermo here.
Yeah.
I don't have a fan with me, so I just want to let you know I do miss you, and I'm glad you participated today. Do we have a motion to adjourn the meeting? Dr. Maldonado made the motion to adjourn the meeting. Ms. Palermo is a second. All in favor, say aye.
Aye.
I.
And the motion was accepted, and the meeting has come to close at 11:52. Thank you so much.
Thank you.
committee members.
Thank you.
Good meeting, Dr. Henderson.
Casey, can y'all hear me? Okay, just wanting to make sure the audio was going through.
Yes, I can hear you fine, Margot.
Just barely I can hear y'all.
I'm gonna take them all.
Yay, Astros. Love it.
Go team.
Already, whenever.
Yeah,
Yes.
she's ready.
Oh,
Yep.
okay. Yes.
Casey, let me know when y'all are ready.
Okay.
It's live right now. If y'all want, can you hear us, Dr. Melcher? Is it loud enough?
We're live.
Is the audio good for you, Dr. Melcher?
Barely. Y'all have to speak loud. Can barely hear y'all for some reason.
It's either that or just.
Turn your volume on your computer up.
I've done that, yeah. On Zoom, the manual, everyone.
Actually, because it happens on my desktop at work too, where I have a hard time hearing people. We'll try to speak up. Please let us know if you need us to repeat anything. But
Yeah, if y'all can just get to the mic close.
Yeah, it's either
Okay.
that or get closer to the mics. That's the only thing I
Yeah.
can suggest, but.
Okay, great, thank you. We ready to begin?
Yes, ma'am.
Okay. Good afternoon, everyone. I would like to go ahead and call our meeting to order. It is 1:01 and for the Continuing Education Review Committee meeting. And if you are listening to the meeting on a secondary device, computer or tablet, please mute it until it is your turn to speak. Please say your name before your verbal vote during the voting process to ensure a proper count. And I will announce the board members when addressing them on a first or second motions. At this time, I'd like to go ahead and read the mission of the TSBDE. It is to protect the public health and safety and promote high quality and safe dental care by providing enforcement, licensing, peer assistance, and related information services to licensees and their patients. Ms. Nichols, will you call roll, please, and confirm that there is a quorum?
Yes, ma'am. Dr. Margot Melcher.
Present.
Dr. George Kirsch.
Present.
Dr. Linda Burke is absent. Miss Lois Palermo.
Present.
And Dr. David Yu.
Present.
We have a quorum. Thank you.
Great, thank you. Our first item of business is committee recommendation and possible action on 22 Texas Administration Code 104.1, continuing education requirement. Ms. Studdard, would you please lead us in discussion?
Yeah, so this is a simple amendment. It's to update the name of the examining board, CDCA, REV, and CETA.
Okay.
I'll make a
Thank you.
motion.
Okay, the motion has been made by Dr. Kirch. May I have a second? Ms. Palermo has seconded. Any discussion?
I
If
had
none, I'd like to
one-
call a vote. All those in favor say
I
aye
had
or raise
one-
your hand.
I had one question.
Okay, sorry about that. Yes, Ms.
That's-
Palermo.
All right. I was wondering if CERTA was left out of here.
Which one?
CERTA. We have credits and we have the new CDCA Rev CETA, but I didn't see CERTA on there.
It is on the list that we were given as a board. It says CDCA, REB, CETA,
Right.
CERTA, and credits.
But do we need to have it here as well?
Yes, if we could then just make an amendment to include CERTA then.
Kind of an editorial change
Okay.
or addition?
Is
Yeah.
that appropriate?
Can we do that? Or does it have to go back?
Oh, no, this is just a proposal.
It's,
so you
per-
can-
it-
Oh,
this
it's
is
just
its
proposal.
first,
Oh, yeah, we can.
first
okay,
go around, so
okay.
we can make changes.
Oh, okay.
That's good.
So after discussion, Ms. Palermo has indicated to include CERTA along with the merge of the others. May I have do we need to do a amendment or vote on that other one first?
I move to amend my motion to include that.
Great, okay. Then may I have a seconded with the amendment of including CERTA? Ms. Palermo? Okay, any further discussion?
And just to clarify, that's going to be listed as an additional approved provider.
Exactly.
Yes.
Yeah,
Yeah.
exactly.
Okay.
And the CERTA is the state's resources for testing and assessments.
Yes.
Yes.
Okay. All right, may I have get a vote now? All those in favor, raise your hand or say aye.
Aye.
Any against? Any abstains? All right, the motion carries. Okay, thank you. The next item of business on our agenda is committee recommendation and possible action on 22 Texas Administrative Code 104.2, continuing education providers. Ms. Studdard, would you please lead us in discussion on this one?
Yes, this is the same proposed change is to update the examining board to the name of CDCA, Reb, and CETA.
This CERTA needs to be in this one too.
Okay.
Yeah.
Well, are they
Credits.
provider?
Credits.
Are they a CE provider?
And credits was left out of this one as well.
But are they a CE provider though? Because this-
Yes,
they are.
because they're both listed in the section where they're providers.
So if y'all recall from our last meeting in August, we were supposed to go through the list and see which ones we wanted to possibly take out, or staff was going to maybe look under some of these as well. So on the list that Ms. Nichols had forwarded to us, it does have in red on that number 12 for cross out Western Regional Examining Board. And then they had CDCA, Reb, CETA, and then CERTA and credits. So all 5 of those were listed under that one.
Yeah.
Oh, so we can just list them all.
Do you see that, Ms. Palermo?
Yeah, I saw that, but it's just, they're just not listed here.
But that means they're still on there. So
Well, it listed all the rest of them, so I didn't know why it wasn't on this one.
okay. Oh, I
But
see
it's
what you're
not.
saying. Yeah.
Oh, I see.
Just for continuity.
Yeah.
Yeah. I agree.
Okay. So staff had made some notation against some that we had, I guess, questioned. And is this the time?
We need to vote.
Yeah. I'll make a motion to accept committee recommendation on 104.2, continuing education providers, with the addition of CDC, CERTA
And credits.
and credits. Yeah.
Right.
Is there a second? Okay, Ms. Palermo has seconded. Discussion. So this is where I'd like a little clarification. Is this the time to discuss others that we had on the list in question?
No, we're just discussing the rule right now, the rule, proposed rule.
Okay,
I think what you're wanting to talk about can wait for till our next agenda item.
is the next agenda item. Okay, just wanting clarification. Thank you. All right. Since there's no further discussion, we'll call a vote. All those in favor, say aye or raise your hand.
Aye.
Any against? Any abstain? All right, the motion carries then. Okay, next item of business is the committee recommendation and possible action on review of continuing education providers pursuant to 22 Texas Administrative Code 104.2. All right, and then this is the one that I'd like to discuss. We had the charge to review the list at our August meeting and to submit them to Ms. Nichols. And we did get a printout from Ms. Nichols that indicated some notation against some of the ones in question. So thank you for doing that. Any discussion on these? Want to go and talk about them? If not, I'll go. Yes, Ms. Palermo?
Yeah, I had some questions about the American Dental Association approved specialty organizations, because I was starting to get a lot of questions where hygienists and people were calling me about this. And Ms. Mendez, you may be able to help me with this, because we've had a lot of individuals across the state that are in specialty dental practices that are like calling themselves study clubs to provide CE, but then they're paying to be PACE providers and AGD providers. So do we have a list of those people somewhere? Or how is it difficult for you to determine what they should be under if they're audited?
Okay, Ms. Palermo, so just to be clear, you're asking if we have any issues with CE documentation for someone, for example, who's being audited, providing just to make sure that we know who they are from the approved list. And
Right.
so what staff will do is that we push it back on the applicant or the licensee to make sure that they contact, if the documentation they submit to us doesn't reflect what we have on our list, or let's say it falls under for example, it falls under the constituents, organizations, the people we don't know about. We'll push back on the licensee to find out, to do a little bit more digging on who exactly approved that course, how that course is being offered, and then come back and give us the information that we need in order to keep pushing forward.
Well, there were just some questions with some people that were going to, like our local orthodontist provides courses and he calls it a study club. But then I'm like, well, shouldn't you fall underneath your specialty organization? But then they don't go through them.
Not if he's not giving CE hours for it. You can have a study club and not give out CE credits.
Right.
Right.
But they are giving out CE credits for it.
Oh.
And I was wondering because, originally a study club was
Right.
set up.
Pace is fine.
Then that's fine.
Yeah, exactly.
Because they have to justify it.
Exactly.
But they can, it appears that a lot of them, they're calling themselves study clubs, but then they've got the PACE or the AGD numbers and stuff. So that would make them a provider that way. But when they get audited, they're calling me and they're like, well, what do I put this under? Just like when we very first started, and it was like the American Dental Hygienists Association, its constituents and component societies. We had to clarify who the component societies were to the people that were taking those courses so that when they got audited, they knew which organization to click under, who provided it. But some people are getting confused between the study clubs and then because they're AGD or PACE or whatever. So I was just wondering if you guys had trouble with that at all, with people figuring out which organization to click on as a provider for CEs.
Yes, we do have some issue with that. But again, it's just talking them through it and kind of doing a little bit more digging And then they're like, oh, okay, yeah, it is a PACE approved or it's AGD.
Right. Yeah, I was just wondering if there was an easier way to do it so y'all don't get bogged down with having to research that stuff. But yeah, because technically, if it's PACE or AGD approved, then that's who they should be putting it under, probably.
Correct.
So
It
do
would
they
be a
not
lot
have,
easier for you and the person that's being audited.
Lois, do they not have like a certificate that has PACE approval that's clearly on there?
You know, I haven't seen all of the CE certificates, and I've mainly just talked to them on the phone.
Okay.
So yeah, I've asked them about that.
Because I
Like in the
obviously,
very beginning of the audit, when you have to click on the provider or whatever, they're like, well, I don't know who I'm supposed to be putting.
Hmm.
So it's just a little bit of probably housekeeping type stuff that might make it a little bit easier for everybody to know. Because like I said in the beginning, you know, we had to let the hygienists know who the component societies were and to put that down as the provider. It's just a matter of educating some of the people with the specialty dentists that are providing CEs.
All right.
So I have to think about it.
I was going to say, I think if they are doing it under a particular study club, as long as they're getting a certificate that has like ADA CERP or what is it, AGD, then they should be fine. But again, we don't ask for copies of those things. So it's hard to, unless
Right.
they're audited, unless to determine. So again, I guess we're just going by, you know, our, their word of mouth that yes, they are, that
Right.
individual is with that organization under their CE speakers. So,
Okay.
but in looking at the list, I did question number 11, the medical schools, because those give out CMEs. They're a little different than our dental. So why do we have them on the list still? Anyone?
Ms. Mendez, do we accept American Medical Association CEs?
We do.
Okay.
Well, I could see it if you were taking a sleep apnea course or you were taking, you know, a course on pre-medication for joint replacements and the American Heart Association, those kind of things through medical schools probably, but I don't know of anybody that's done them.
Yes, see, I wasn't aware that we could take CMEs, those kind of things. So that's good to know. And that may be something to maybe put in a future newsletter, because maybe there's a lot of licensees that don't know that as well.
And on my end, Dr. Melcher, if you're okay with it, I've actually taken some CEs on neurology, immunology, things that dental, you know, specific
Sure.
don't cover.
That's true.
No, I think that's great. I just think
Yeah.
sometimes the average dental provider does not know that. You know, it's always a dental CE course, you know, related somehow. But I do agree, those are related specialties that could be of use for us as providers. And then I'm not, and Lois, maybe you can help me with this one. The American Academy of Dental Hygiene, is that in existence?
Yes, that is in existence, and it's kind of equivalent to the Academy of General Dentistry.
AGD, yeah.
Yeah.
Okay.
It's just the dental hygiene one.
Okay, great. And then there was something of the compliance division. Y'all made a note on here that it has CE and OSHA, HIPAA, but we were wondering if they were still offering these. So my sense is if maybe we remove them, and then if they do offer these CEs in a dental related topic, could they go up for a request to renew or to reapply? 'Cause I haven't, have y'all seen any come through for, heard of these?
I'm wondering if the temp agencies are referring temps to those online courses for HIPAA and OSHA updates. Because I know some of the temp agencies, when they have hygienists and assistants working for them, they will let them know that, and they actually have them take some courses in OSHA and HIPAA to be a temp. But I'm not sure if the compliance division is one of them.
Yeah. I mean, because OSHA has their own CE courses that they provide, as well as HIPAA. So that's where I'm sort of tending to remove this one from the list. And if in the event in the future they want to reapply as a provider, then we could acknowledge them then. But I think our purpose was to sort of streamline these CE providers, make sure we're supporting the appropriate ones or the ones that are active and not just sort of sitting there. Yes, Ms. Stutter.
I just wanted to say, so the rule requirement is if you're going to remove any providers that they be given notice. And so we would have to, provide notice before making any type of changes.
I think that would be great to reach out to them, and to find out if they are active or not. So I did have that one that I would recommend. And then the under the other entities, staff noted that dental quality assurance and C, dentist secure labs. They were unsure about their content. So maybe those are two others to address, to reach out to.
It was dental quality assurance, and I'm sorry, what was the other one?
It was A under other entities and C, dentist secure labs.
Thank you.
And committee members, there weren't any others. I think that was it. That's from the list you provided, Ms. Nichols. So I would say if we could have staff then look into those three.
So per the rule and what Ms. Stutter just pointed out, what we would do is send them all a notice that we plan to remove them from the list, and then that would give them the opportunity to appear and provide an application and updated application and that sort of thing.
Okay. Do we need to make a motion for that?
What do you think?
Do we?
I think this is just more research. I think this is just direction to staff more so than a full board vote type.
We'll put it on the agenda for the next meeting.
Yeah.
Okay, great. Okay, any other discussion on this topic? Okay, are there any public comments?
Nope.
Okay, any announcements? Okay. Do I hear a motion to adjourn this meeting?
So moved.
Okay. Dr. Kirsch has made the motion. It's been seconded by Ms. Palermo. All right. It is 1:23 and we will adjourn our CE meeting.
Need a vote.
Thank y'all.
Oh, we need to vote.
Need a vote.
Oh, sorry. All those in favor of adjourning this meeting?
Aye.
Aye. Any against? Abstain? The motion carries. It is still 1:23. All right.
Good
Thank
job, Dr.
y'all.
Morgan.
And Dr. Melcher, just quickly before you go, for tomorrow, when we go over the board report for CE review, is Ms. Palermo going to do that as your vice chair, or would you like board staff to go over it for you?
Ms. Palermo, are you able to do that?
I should be able to do that with their help.
Great.
Thank you.
I appreciate y'all doing that on my absence. Here at the School of Dentistry, we're going to be having our Give Vets a Small event tomorrow. So looking forward to it.
Thank you for doing that.
Awesome.
Great
Yeah.
job.
All right. Thank y'all. Have a great day.
Bye, you
Dr.
too.
Fletcher.
Bye.
Bye-bye.
Okay.
The November 3rd, 2022 Anesthesia Committee meeting of the Texas State Board of Dental Examiners will now come to order. The time is 2:02. If you're listening on a remote device, please mute it until it's your turn to speak. Please say your name before you're voting. And I will also do my best to address those people as you vote to make sure it's clear for recording. The mission of the Texas State Board of Dental Examiners is to protect the public health and safety and promote high quality and safe dental care by providing enforcement, licensing, peer assistance, and related information services to licensees and their patients. Ms. Nichols, would you please call roll and confirm that we have a quorum for this meeting?
Yes, sir. Dr. Brian Henderson,
Present.
Dr. Robert McNeil,
Present.
Dr. George Kirsch,
Present.
Dr. Linda Burke is absent, Miss Lori Jones,
Present.
and Dr. David Yu is absent. We have a quorum.
Thank you, Ms. Nichols. Welcome, committee members, and thank you for your participation today. I'd like to call on Mr. Lannon to lead the discussion concerning some committee recommendations and possible action on staff update pertaining to sedation and anesthesia inspections. Lee, if you would, please.
Lee, unmute.
You're still muted.
There you
Here
go.
we go.
Now you're good. Go ahead, Lee.
Oh, we still
No,
can't
we
hear
still
you.
can't hear you.
Yes.
Now it's muted. You might need to run into Christine's office, maybe. Sorry, guys. You can try it. You want to try it again? Oh, she's there helping you.
Oh, what's she doing over here? I know, right?
Working on her PhD. Writing her dissertation.
I think she's playing video games. Well,
Lee,
Miss Mendez, any chance?
She's in there with him.
Oh, they are together.
yes.
Oh, I see her. Okay. Well, I was gonna say, if we catch her in her.
They're gonna go in her office, it looks like.
Oh,
All right,
perfect.
here we go. It's not a long walk.
No,
Beautiful.
They could skip.
we
Be
could,
right-
we could adjourn and let him walk here if he would. like.
Yeah, give it a few minutes.
Oh, she's raising her desk.
Oh. That's.
Christine, we can't hear you. She's unmuted, but I still can't hear her.
Is
Yeah.
it a speaker issue in this room? I don't. So.
Because hers was working fine.
Hey, Dr. Bell, can you talk to us?
Yes, I'm happy
guys hear
to.
us
Can
now?
you?
Oh,
Yeah,
we
Now we
got it.
got
hear
it.
Dr.
Now we
Bell.
got it.
Yep.
Got it.
Thank you.
Thank you, Dr. Bell.
Oh, there we go. Good. Now we can hear you.
All right, I'm sorry, guys. So what I wanted to do is give you some information on our inspections, specifically regarding the affidavit follow-up inspections that we started in July. So if you remember back in 2019, we started our inspections in 2018, but in 2019, we needed a way to mitigate the violations that came from dentists not properly reporting the vitals during treatment or on the preoperative sedation checklist. And so at that time, it was put forth an affidavit for the dentist to sign, and it would mitigate those violations. And that way then it would take care of that inspection, and then it would push us forward to maybe sometime in the future that we would do an inspection to follow up to make sure that they were still complying with it. And as a reminder, that affidavit that they signed, they state that they would review the rules and that they would follow the requirements. And if they were ever found to not be following the requirements, then the board could take public action if needed. And so if you fast forward to where we are right now, we started these affidavit follow-up inspections in July. So July through September, we had 79 of these inspections. And I just want to share with you some of the violations that we found with these individuals that we went back to. So these violations that I'm going to talk about right now are ones that can be mitigated within that 30 days, such as some not using the preoperative sedation checklist at all, or using an outdated one that they were using back, let's say in 2019, they corrected, gave us a copy of it to mitigate, stopped using it, started using the old one that they had prior. We have some that have drug logs that are drugs that were expired, excuse me. Some that were missing staff training logs, missing annual review logs, AED pads that were expired. We had 8 individuals that had those. We had one that had online BLS, which was corrected in the original inspection back in, let's say, 2019. Now let's talk about the individuals that the reason that they got that affidavit follow-up, or reason that they got that affidavit was because they were missing things such as not documenting respiratory rate every 10 or 5 minutes during treatment, or not documenting it during the preoperative sedation or on the preoperative sedation checklist. So currently, we've had 5 of those not documenting the respiratory rate. I had one that wasn't documenting any of the vitals during treatment. We had one that didn't have respiratory rate on the preoperative sedation checklist. We had 4 that weren't documenting the pulse oximetry during treatment. And then one that wasn't documenting the blood pressure during treatment. And with these, and some of them were combined together during the inspection in one inspection, but we had a total of 8 risk-based tier 2 inspections that have went forward or have pushed the CED forward. And then I have 2 right now that are pending. So that would be a total of 10 just since July. That's from July through September of individuals that did not follow the affidavit that they had signed, let's say back in 2019 or 2020.
Okay. Thank you. Yes, you had something else, Lee.
Another part of this is that we also went back to individuals that signed the affidavit that they wanted to go exempt, or they wanted to go inactive for their inspection. So we're going back to them and saying, hey, are you still wanting to be in that status? And do you still understand your roles and responsibilities while in that status? And so since July through September, we've done 44 of those. We don't literally go out to them if they want to go back or stay in that status. They just complete the affidavit again. But we found one so far that was in the exempt status that was practicing out there between July and September out of 44 individuals that we've touched during this time.
Okay. Dr. McNeil.
Thank you, Dr. Henderson, and thank you, Lee, for that information. Obviously, we're all probably very concerned about what we just heard there. I know from being someone who was on the Blue Ribbon panel originally, when we saw issues, record-keeping issues, that certainly was an indication of people having some negative clinical outcomes. From a disciplinary review component, these are cases that the threshold should be higher. And if we look at our matrix, and I guess if we can get some sort of guidance at some point during this meeting from the attorneys, and I don't know if we come up with some sort of general consensus or guideline or talk about, this is not something, for instance, like from my perspective, they were kind of given an opportunity to self-correct and, quite frankly, in my own words, an act of grace. But also part of that was just being prudent and saying, okay, you were doing it every 15 minutes, you got to do it every 10, just sign something, say you're going to take vitals every 10 and record it, and we move on down the road. Well, now we're down the road and you didn't do what you said you were going to do. And you're doing that whilst sedating people. And we know that can be a huge problem.
Great.
Any other committee members have any thoughts over this discussion?
Dr. Bell has her hand raised.
Dr. Bell, would love to hear your comments, please.
Thank you. So one thing that I missed that may have been there, but is Lee, maybe you can explain how we're handling them now. And then maybe I'm sure they would have feedback as in if that's okay, or if they suggest some other path.
Yes, ma'am. So currently, these individuals that are found, let's say they're not recording respiratory rate or whatever, or are vital at the appropriate intervals when they're supposed to, then we proceed to the risk-based tier 2. We pull the 5 extra records, and of course we do the CED and then forward that out for review.
Dr. Bell, does that answer your?
But yeah, I mean, basically we have probably 6 or 7 of these that are with DRP, either
yes,
will be very soon or right now. But to them, they look like tier 2 inspections, they, I'm sure will handle it as they would any tier 2, but that's how we're handling them right now. And DRP is actively working those cases.
Thank you. So Dr. McNeil, something you'd like to?
I was just wondering, can we have someone from the legal team kind of read something as far as the legal language for the attestation that they would have signed?
Absolutely. So the affidavit that we're referring to, the record keeping affidavit, that's at issue here. I won't read the whole thing, won't bore you all. But it acknowledges that they were deficient in a record keeping issue concerning their anesthesia permit level, and that they're going to basically fix it. And at the bottom in bold, it says that I understand that if I am found to have administered levels blank sedation anesthesia after the date of this affidavit without properly observing the requirements of the applicable sedation anesthesia permit level, the board shall take public disciplinary action against my Texas dental license, including possible suspension or revocation of my sedation or anesthesia permits. So that's what they're acknowledging that they're doing or going to do and what the repercussions are. And so now we're just checking to make sure that's the case, and
They signed that.
they've signed it and dated it.
We have a copy of that.
And that signing of this then prevents them from going to a tier 2 originally. So yeah.
Unless they don't fulfill their obligation on that asset state.
And that's kind of what we're doing now. Yeah.
Okay.
And so, the committee members just shooting from when we wrote this rule and put it into place. The whole idea was that we would have an inspection, and if someone was lacking in some area, they could sign an attestation to say they would correct it to prevent going to tier 2. And I think if we found any evidence at any time, they automatically go to a tier 2 inspection and let it be handled appropriately through the DRP and or ISC SOA hearing process. It concerns me that I hear that someone said they were in an exempt status and out practicing, and that actually is a license to be revoked, dental license, not anesthesia permit. I'm not going to ask where we stand with that process and if that was something that was sent through the system, but that same affidavit that was similar read about a lacking of a blood pressure. This is about someone who said, I'm not going to do anesthesia, and it's outside of an exempt area, but now we catch them out. I think that is very more concerning to me than someone who may only be taking a respiratory rate in a 15-minute interval than a 10-minute interval. So I applaud the agency of looking at some kind of issues about following up in some form. I would be hesitant to be too aggressive, and knowing that depending on what the level of inspection default and the initial inspection, to go back and be too aggressive into someone's office. But I do think you need to take in consideration the severity of what we're asking, and what someone that says, I'm not even going to fill out a preoperative checklist. an in your face kind of deal, I think that automatically goes to a tier 2. And that's why we have that tier 2 inspection, where we get more than that one snapshot of a record that they hand us. We'll go pick 5 and see if you're really following the rules or not. So that's my opinion sitting here. But I'm also happy to hear everybody else's
I
comments
agree
or
with
thoughts.
that. I totally agree.
Dr. McNeil?
Lee has a question.
Lee, go ahead.
Yes, sir. So I just wanted to say that some of these were not just, I just use that as an example, the 15 or 10 minutes. Some of them didn't have it at all. And then some of them had, let's say, blood pressure in there. I'm just using an example, and I'm not sure if that's one of them, but blood pressure in the original, and they were taking it. And then we told them, well, you or let them know based on rule that you needed to take respiratory rate every 10 or 15 minutes, or 10 or 5 or 10 minutes during the treatment. You fast forward now years later, they had blood pressure in the original one, and now they don't have blood pressure in this one. But they have respiratory rate there, and it might be every 15 minutes, or it just totally disappears.
Right.
Wouldn't that just
So-
make that a tier 2?
So I think
Yes.
that's a pretty easy thing to
Yes.
send to the DRP
Yeah,
and run up the tier 2 inspection
I
level.
agree.
I mean, that's really what the point of the rule was.
Exactly.
Is that too much pressure on the DRP? Maybe we need to get Dr. Bell. If we're only talking 10 cases, are we
Dr. Bell has a question.
over pressuring? Go ahead, Dr. Bell.
No, I mean, just to comment, I don't think they're over pressured. I mean, it's kind of it seems to be a lot all at once. It's been probably within the past 2 or 3 weeks, but they'll get assigned when they can, just like all of our cases. So I don't think it's too much pressure. And like all tier 2s, they aren't opened as official complaints if DRP finds no violation.
Right.
So if y'all were thinking of handling these differently, whereas since they've already done wrong, didn't have to be tier 2'd, and now they're still going down the same path, I don't know if it would be prudent to have a different path for these guys. But for right now, we are following the guidance of the tier 2. It's not an official complaint unless DRP finds a violation. If they do, then most likely you will see that at ISC.
I just had
Look,
some,
yeah.
Dr. Henderson.
Yes,
I, and I think there's still some confusion out in the dental professional world about these follow-up inspections. They do receive notice that we are coming as a follow-up inspection. But I think it would be helpful for staff if we had this in rule, so we can refer to it when we do these type of follow-up inspections.
Okay. So, Ms. Studdard, we do put them on notice that we're coming back. We give them the same time frame that is in our original rule of notice, or is it a shorter time frame?
Lee has coming in.
I
Lee?
can tell you they get 60 days notice, and then they'll get what is called a 10-day notice from the inspector, but really it's a 30-day notice because they start contacting them way in advance. So if there was any deficiency, it even refers to what rule that it tells them what they've done, not specifically what the violation that they did before, but it refers them to what we're looking for. So there shouldn't be, they have time, if they didn't have it, they have time to review it to make sure that it was correct at that time. And some statistics on this, just to let you know that, let's say we've done 3,000 inspections since 2018. There's probably less than 500 of these that fall under this affidavit follow-up inspection.
Yeah, and so I guess that's kind of where I'm going with my thought, and I appreciate the rule comment. And when we're talking, you found 10 out of the multiple inspections that we have that we're talking about. Is that 10 worth writing a rule for as opposed to handling it as a tier 2 inspection as the current rule is there? Or is there some simple language we can put in the rule of inspection to say if they're short with some affidavit, we can put some language, we may come back in as opposed to rewriting an entire rule?
It wouldn't be an entire rule. My suggestion would be going back to 110.18, our inspection.
And just
adding
some
language.
verbiage in there.
Right.
Okay. Dr. McNeil.
This is a question for Lee, probably. right now, I know we had sort of, as this was a work in progress, you reached out to the board and said, hey, for things like respiratory rate or vitals being at a different interval than the rule had stated, that's when we kind of gave them the ability to do this attestation as opposed to immediately jumping to a tier 2 inspection. What is the criteria now if someone has something that they fail on their initial inspection? What are they allowed to attest and avoid the tier 2 right now?
So back then, the only thing that they couldn't remedy was something to do with the vitals, anything to do with the vitals. And that's why that affidavit came forward or was produced. So back then, they would go straight to a risk-based tier 2, but we stopped that and came forward with the affidavit to stop that, I guess, if you will. And so currently, if you're in a tier 1 inspection, there's really nothing that they can't take care of within that 30 days, and the tier 2 would be complete. Including if they were missing a vital or what have you, they just sign the affidavit. Now, the affidavit is what draws us to go back at some time. There's no specific time for us to go back, but we can go back.
Now, Lee, you used the comment a tier 2 would be complete. Do you mean a tier 2 would be avoided?
Avoided. I'm sorry. If I said it that way, I'm sorry.
So no matter what sort of infraction on the tier 1, they can attest no matter what it is. If they're not using a checklist, they're doing no vitals at all, there's nothing that will push, excuse me, for an automatic tier 2?
No, sir. And it's not just the attestation or this affidavit that would clear it. It could be that they're missing CEs or their BLS is online only or not in person or whatever. They have 30 days to take care of those. There's nothing on that checklist or inspection form that they can't take care of in 30 days in that initial inspection.
And then and you threw out some numbers there, 3,000 inspections, 500 people that less than 500. And then of that less than 500, are we talking about half of those 500 are kind of being an issue, or you've gone back into 70 of those people and 70
between July and September, we've done 79 of them. And at this point, there are 10 that are going forward with the risk-based tier 2. I point out the other violations just simply to say that there are things out there that we pointed out in the initial inspection, gave them the 30 days to fix.
And they're not.
CEs, not having CEs, not having BLS, not having PALS or whatever. And we go back because the affidavit follow-up is letting us go back, or we're going back based on that, and we're finding the same discrepancy again, or violation again.
Why would they not go to tier 2 then?
Yep, that's that
I-
question.
What?
Ms. Jones,
Why would they not go to tier 2 then?
Yeah.
And
When? Do you think now?
Lee, did you hear Ms. Jones's question?
Yes, sir, I did. Those items or those issues can be mitigated in the 30 days and they can prove that they have it. The only thing that drove us to go back was this affidavit based on the violation of recordings.
Okay, so I'm going to rephrase what Ms. Jones may have, I don't want to put words in her mouth. So what I'm understanding is that their initial inspection said they didn't take their blood pressure at an appropriate time, and you went back in and you found out that they had expired drugs, something completely different. That should institute an immediate tier 2 inspection. I agree. Because they signed the original affidavit saying that they would have everything. So if this is something that's totally different, it's not something that you should have to reinvent the wheel for. That automatically goes to a tier 2 inspection, in my opinion. But yes.
So would that fall underneath the unsworn declaration?
Ms. Camp, then I'll ask legal to give its opinion and answer that question.
So as far as talking about anything going automatically to a tier 2, the way that the rule is currently written, that is not possible. The tier 1 rule states that any violation found, we have to give them 30 days to try and rectify it.
Right.
So some of these things that you're talking about, they should immediately go to a tier 2.
We're saying
Are not-
after they go back.
Right, after the 30 days.
Well, so that's what we're talking about. Like, but they're going back at the 30 days. There should be a tier 2
if they
informed at that
found a
time, right?
deficiency. Right.
Well, no, that's if they find a deficiency, right?
Yes.
But if they're going back, and from what I understand is they're going back, maybe checking the records to see if blood pressure is now doing it, but now they're really out of compliance for their CE. You know, is that correct, Lee?
So it's individuals, we go back based on a vitals violation in the recordings affidavit. And let's say that original inspection, we go back to these dentists, they may not be one that we went back and they had a recordings violation again. It could be that in the initial inspection, they were missing CEs. We went back, what drove us back was the recordings violation. We got there and lo and behold, they fixed their recordings violation, but their CEs were out again. And we give them the 30 days to fix that. So then that takes care of that inspection. The one that drives the risk-based tier 2 currently is if you go back and there's some part of the vitals is messed up again, say missing respiratory rate all the way across. I go to that because that's quite often. And then that's when we go to the risk-based tier 2, not if they're missing BLS or PALS or something like that. But I was just simply pointing out that those things, if they were missing in the first inspection and we came back because this affidavit is driving us to go back, we're seeing those violations over again, not just the recordings piece of it.
Right. And so you're saying right now that you cannot go to a tier 2 because of that?
We have not gone to a tier 2 because of that. If we saw something like that twice, the only part that's driving us to the tier 2 has been the recordings piece of it.
But we can go to a tier.
So you want to go to a tier 2 because there's an issue with CE and BLS whenever they come back?
Yes.
Yeah, or drugs expired
Or anything.
It-
They attested
you-
they're gonna
you
follow all
have-
the
You're gonna
rules.
follow the rules,
All the rules for anesthesia.
all the rules.
Right.
And if we find
I
something
think
else,
I think I'm talking about something completely different than y'all are, because I think that's the question as to why we're here today is, do you want to, on these follow-ups, go back and do tier 1 and do a tier 2, or do we want to write the rules such that it can just be a tier 2-ish type situation where you're going in and pulling 5 records anyway, because you've already had a tier 1 inspection originally, which we noticed you up in that letter. And that's kind of the question we're trying to get at. Should we rewrite the rules so that going forward, anytime, because obviously we're going to continue to have inspections since we have to inspect new permit holders, right? Anytime that we have this record keeping issue going forward or such that, or if they don't remedy it or they have whatever, should you instruct us to write a rule or just instruct us to go ahead and say, treat it like a tier 2, pull the records because you've already been subject to the tier 1.
Right.
Does that make sense?
I understand. Yeah.
Because in that case, I think it would be if there was any deficiency under the rule, you would go to a tier 2.
Automatically go to tier 2.
Yeah.
Ms. Nichols.
And to Lauren's point, legal would feel more comfortable having a rule backing up this versus just having an internal policy.
Yeah, I see that. And to me, and then I guess this is where I struggle with what made all of a sudden July come in that we start going back into someone's office when we've been inspecting for a number of years, and what triggered the July to go back into it. And if you just pick on people with respiratory rate, and everybody wants to talk about respiratory rate because our rule says we got to record it every 5 minutes. But in the anesthesia world, nobody records respiratory rate every 5 minutes. And we're talking physician anesthesiologists that you will not find. You'll find a respiratory rate and usually a line, or you put them on a ventilator and you'll set the rate. And it's that rate until you change the rate or they become spontaneous. The point is our rules in the other parts of the chapter is what makes this inspection process more difficult. And rather than trying to add some kind of language to this, I'd like to personally work on the other parts of the chapter to help clarify the monitoring, because this sounds like it's a paperwork or record keeping issue that more than it is. To me, when someone says I've got expired drugs, or I don't have the CE that's adequate, or I say I'm not going to sedate and I'm sedate, I'd say go in there and go after them. But if we're talking about someone who this time put it at a 5-minute blood pressure and then put it, or was it a 15 and then moved it to 5, but this time they didn't put the respiratory rate. I don't know that are a big emergency of safety in that case. And we're spending a lot of time and effort to send inspectors and tax dollars into this office for that. If there's something there, I think you should go in there and go after it. And that's kind of what the whole point of the tier 2 was, when someone had a violation and that record was seen by somebody in the DRP and Dr. Bell's office, and they had a violation. You've signed an affidavit, whether you had CE or whether you had a expired drug, that is actually a significant penalty. And it's not just a slap on the wrist. And that's why they signed that serious affidavit, because anesthesia causes life mistakes, in my opinion.
I'd like to hear what you're going to say.
Well, my follow-up to that was, but I think don't we need a mechanism to up it to a tier 2? Don't at this point, like, if regardless of whether it's a record keeping or something else is found, like, don't we need to close the loop and create a mechanism where we can immediately go to a tier 2? That was my understanding, and if I'm wrong, I'm sorry.
In general.
Yeah, the way the rule is written now, I think we need to clarify what we're talking about here. And Dr. Henderson, I don't know if you want to list like certain violations where we only go back with these follow-up inspections, or is that getting too specific?
But Lee raised his hand immediately when you brought that up, so maybe he can clarify.
Lee, do you have a thought on this?
So you were asking about why specifically we went back in July, but just as a reminder, we were fulfilling that legislative requirement that we wanted to be completed by 1 September 2022. And we completed that in June. And so that allowed us to start working on these other things that were out there, which meant go back to see these follow-up affidavits. Now, we're not seeing all of them. We're not doing all of them in 1 month, by no means. We have the newbies, if you will. We have the exempt and the inactive, and then we have these as well. So it's a mix every month. It's not the same. And we're not just going back to pick them per se.
Jones.
So what I understand from what says, a permit holder with a violation on a compliance tier 1 inspection that is not remedied shall be referred to a risk-based inspection. So would that not then cover if something else was to be found, even though they're going back for vitals? Would that not cover if something else is found to increase that now to a level 2?
I think this may be a good time to bring in Laura Diamond, who is a defense attorney and who would like to speak on this issue, because I think the issue is that the way that the rule is written, we can hear her argument, but she's going to argue, actually, maybe this is a good time to bring her in so we can discuss.
It's a good idea.
And I'd like to make a comment while we bring her.
Yes.
In whatever.
Go ahead,
venue.
Dr. McNeil.
You know, as I look at it, even if you take the tier 2 out completely, we've got someone who had a tier 1, signed an attestation. We have a go back inspection that said, okay, now there's a problem. Take out tier 2, that goes to DRP right away. You sign something saying you understand you could have a suspension or revocation of your anesthesia sedation permit.
And I think that's what's confusing licensees. It's like we're investigating under this anesthesia inspection realm, and we're all the documents that we're using, all our checklists the inspectors are using says anesthesia inspection. And so maybe that is, instead of putting it under the anesthesia inspection umbrella, maybe we put it under our investigative complaint umbrella. Is
You know,
that what you're
I just look
saying?
I just look at it and say, we probably have enough evidence to do something. And we've given you grace and said, here's what you did. Here's what you did not fulfill rules wise. You're testing, you change, and you're going to know the rules and abide by the rules. And then we came back and you didn't do it. that should be an automatic, easy to get something to APRP. If you don't do the small things right, you're not going to do the big things right. And that's what we found in Blue Ribbon Panel. And I think that's what we continue to see. And so maybe that, I don't even know if the tier 2 is a moot point. I wouldn't be opposed to giving a new rule because it makes sense if you say we go back and we want to collect more information if you think we need that. But let's hear what Miss Diamond's gonna.
She's on the line if you're ready.
Oh, all right. Ms. Diamond, are you available to address some of these issues?
I'm here. Can you hear me?
Yes, ma'am. Thank you so much for participating. Please
Yeah.
identify yourself and who you represent.
Well, my name is Laura Diamond. I'm a defense attorney and practicing in Austin. I'm not speaking on behalf of any particular client, obviously in a public forum, but just generally to Lauren's point that providers are concerned and confused about how the inspection process is going. So first, I appreciate you hearing from me today. I want to preface my comments by noting that we all share the common goal of ensuring the provision of safe care, particularly with regard to anesthesia. I've been in ISCs with all of you where we've worked difficult cases with bad outcomes, bad anesthesia outcomes. So we all know that we need to follow the rules. I also understand that there were some dentists who signed these affidavits in 2019 and that I'm with you, they should have complied. They should be complying. When you guys go back in, there's no reason they shouldn't be in full compliance with all the rules. As you know from Lee's report, there are some dentists who still are not in compliance. I agree that something should be done so that they're in compliance. And I know that they signed the affidavit saying that they would be in compliance with all the rules. I get it. But they did not sign an affidavit and cannot sign an affidavit that waives their rights under the rules. And Rule 110.18 gives them a 30-day remediation period. So when they sign an affidavit in 2019, and then they're re-inspected in 2022 on a tier 1 inspection, I think it's a problem if it's immediately jumped to tier 2. I've represented dentists who were jumped to tier 2 the same day or the next day with 5 charts pulled immediately. I respectfully believe that that's a violation of the rule. There's no mechanism in the current rule to immediately jump to tier 2. I'm not saying it's okay for them to have signed the affidavit and still not be in compliance. That's not what I'm advocating for. What I'm saying is the way the rule is currently written, they're supposed to be given a 30-day remediation period. What's happening is they're pulling 5 more charts immediately from the same time frame, right? Inspection, right? They go back to pick a month, July of 2021. Any violation that you find in chart 1 is going to replicate, right? Almost certainly in charts 2 through 6. So we know what's going to happen, right? The DRP report's not going to be positive. The dentist is going to end up in ISC. And I understand, I hear Dr. Henderson, I understand your point when you say, hey, you signed this affidavit, so we're coming after you hard, right? You said you'd comply and now you're still not. I get it. I get why you're there. But my point from a legal standpoint is I don't think we should even be there because I'm not sure those 5 charts should have been pulled to start with because they weren't given their 30-day remediation period.
Committee members, do you have any questions that you'd like to ask Ms. Diamond?
I have a question more for our own legal
Okay.
team. If we look at it, when we go back in, that's not a tier 2 inspection. Is that a continuation of the initial event that happened? Do we have to count 30 days times 2 for this versus you said you didn't rectify something?
So that's really kind of what my question was going to actually be to Ms. Diamond.
Right.
I mean, you say she was someone was entitled to a 30 days. Well, that 30 days is come and gone. We're talking 2 or 3 years. So they've had not just 30 days to fix that,
2 years.
but multiple days to fix it.
Right. I hear your point, but on the converse, it's a reinspection. They were inspected in 2019. They remedied by signing the affidavit. Now, whether they actually did that, I get it. You're not happy about that. I understand. But putting that aside, when you come back in 2022, 2 to 3 years later, and the notice letter that they get says that they're going to be in a tier 1. So then, yeah, they get another 30 days. And I understand why you're not happy about it. I get it, but that's the way the rule's written.
Right.
So before we start pulling charts,
Exactly what she's saying.
Thank you. So I'm gonna ask Ms. Studdard.
I agree.
So we don't go re-inspect. They sign an affidavit. We see them in a DRP or some other thing, and we have a note that they were supposed to have corrected this, didn't have a preoperative. That information is given to the DRP that they've signed an affidavit and that it's not really a moot point. It is a major problem, and we'll handle it that way. We won't go back in and re-inspect. We'll catch them on the backside, because the people that are probably breaking this rule are the same people we're seeing in the DRP violations with open crowns and also doing anesthesia, not having this. And that information is just tied together with the DRP on the initial complaint. I don't know what the committee thinks, but I'd like to hear what legal thinks about that.
Well, yeah, go ahead.
Okay, I just want to clarify something here, and I'm going to read from an actual notice letter on an tier or re-inspection. Just so that we're aware, because it actually does not say that we're coming back in to a tier 1. It says that we're coming back in for a follow-up anesthesia inspection. So what it actually says is your compliance tier 1 inspection was conducted on date. During this inspection, a record violation was noted. You submitted a violation of records affidavit to mitigate this violation at the initial inspection. As a result of signing this affidavit, the board has scheduled a follow-up anesthesia inspection. Your follow-up will be conducted during the month of blank. So we're not actually going in and calling it a tier 1 inspection. I understand that what our inspectors have as far as resources go to conduct these, they are going based off of their training and starting at a tier 1. But
So based on what you just read,
Uh-huh.
we come in 2 years later,
Uh-huh.
we are doing a re-inspection. We're not doing a tier 1. And if we find a violation, why can't we pull 5 charges?
But are we doing a re-inspection? Are we doing a follow-up on the first inspection? So I'm going to say, what does council think about that? And I know we know what Ms. Diamond feels about this. That's a re-inspection. But based on that language, could we argue we are just continuing the initial inspection?
Exactly.
That's what it is.
Exactly.
Yes, exactly. What
And their 30 days is come and gone, and they automatically go to a tier 2. And then all the public understands, you get a letter that we're going to come back and look at just now. So this is where we're going to go back with Lee. They're going back and just looking for the record deficiency. They're not looking for something else. You go find something new and different. That is a re-inspection. Am I wrong with looking at that way?
well,
I would ask Lee.
I think you could argue that. I mean, I think that's been our argument, but I just think it would be more clear if we put it in what we're.
Okay.
I believe staff has been viewing it the way you just described.
Okay.
But I think defense counsel is going to view it the way Ms. Diamond just expressed. And so I think for clarity's sake, that's why we discussed making it as crystal clear as possible.
And it doesn't have to be a huge change. It could be a couple of sentences in our inspection rule about these inspections.
Okay. Any other comments? Is there any other public comments? Because I would like to be fair with those people in the room. If they have any comments that they would like to, we don't have any turned in. And Chris, no other public comments on okay.
Ms. Diamond was the only one who signed up to speak.
Thank you, Ms. Diamond, for your participation. Any last words I'll give you another minute if there was anything else you would like to say.
no, thank you. I appreciate you hearing me out. And just please know, we really are trying to comply. I think the providers need some clarity. The rule says 30 days. And when you're talking 2 years later, there's really not clarity about, I mean, are we really keeping an inspection open for 3 years? Seems like a long time. At the same time, please know that I understand people sign these affidavits and they need to do right. I just want to make sure everybody's clear on what the procedure is.
Thank you.
Dr. Bell, you would have something you would like to say, please.
If y'all were to contemplate modifying the rules, it might be prudent to have a category that doesn't require a tier 2. You know, if their CPR is expired, well, I mean, Dr. McNeil is correct in that maybe that means that their patient care is lacking too, because they didn't notice that their CPR was expired. But, you know, if it's obviously the pre-op form, the more patient care oriented items, then of course, yeah, tier 2 makes sense. But there may be a category that just then is like when investigations has a non-SOC violation. That doesn't come through DRP. You know, the violation's clear without an expert to evaluate it, and then they just go to an ISC from there. You know, that's also a possibility. So, but I do see the value in pulling charts as well. So, but just contemplate that. We're already used to kind of bifurcating non-SOC and SOC. So we could continue down that path here. Whereas if they said, I will remedy this, and they did not, and it doesn't really have to do with patient care intimately, then maybe there's another option.
Yeah, and so that's kind of where I am. You know, there's a big difference between patient safety and record keeping. You know, if we're not documenting and writing out what we really need to, I know it's really serious in anesthesia to have adequate records, but how many dental records do we look at every day that have record violation issues? And we're just talking about anesthesia records. And a lot of times those record violations in the dental world, they just kind of like throw them aside. I think it's important. I think it's a slippery slope when we start talking about re-inspecting randomly offices for what need. If it's a record inspection, would you go in and inspect someone that didn't take their blood pressure on their patients before they gave local anesthetic? I mean, indirectly, that's what we're talking about. So we don't do that. So I'd be a little cautious on what egregious is causing us to go in and look at this. But I would think it's something I would like Dr. McNeil. These dentists have said, we're going to follow these rules. We're going to do the CE. We're going to have our emergency medicine. We're going to do our preoperative checklist. And if we at any time find they're not doing that, that is not, it could be a tier 2 inspection. It can come out of a DRP, but it really should go ahead and be noted by the DRP person that they already have had this inspection and that they're already supposed to have been doing this. And that here's the attestation that they signed to do it. And do they feel that is something that we should pull permits on? Or do we throw them in the locker room when we take their dental license? Because that is an option as well if we think people are doing dangerous anesthesia out there. That's my take on it. Dr. McNeil.
So from legal, can we carve out something that's workable where we don't have to go to a tier 2 based on the signed attestation? We've got documentation, or do we feel that someone like Ms. Diamond is making a strong argument that no, gave them 30 days. Now we're back here again for the second part of the initial inspection. We got to give them another 30 days, and then we got to go back out to inspect it.
That'll be for it. Yes.
What does legal think on that?
It can't.
Currently, as we stand without further rule modifications.
I think if you look at 110.18a, very broad, that we can perform inspections to effectuate this. Is that sufficient to go ahead and do these re-inspections? Perhaps. Would we be on better legal footing if we had specific rules? Probably. Because you also have to keep in mind that this idea of the tier 1, tier 2, that was of our own making. So we have broad authority under the inspection statute to make the rules for the re-inspections. So we're not necessarily doing tier 1, tier 2 because the legislature told us we had to make sure we're keeping people safe. This is what
the board at that time thought would keep people safe. Now we're thinking that maybe another added layer of keeping people safe is clarifying that in addition to doing your initial inspections, if you've met these criteria, you've signed this affidavit, you've made this sworn declaration, then yes, the board can go back in and take a look. Again, it's one of those things, I think there is a rule broad enough for you all to be able to do this without necessarily having a rule change. But we are going to be having these conversations amongst our defense bar for many, many days to come after this. So I think you could go either way. I think one way is a little bit stronger for you since you do have the authority to make rules related to inspections. But I think ultimately it is your committee's call.
Dr. McNeil?
If we did a rule change, how would that impact the people in the hopper right now who've had these 10 or greater than 10% of people? Because those people concern the daylights out of me. And especially the one who attested they weren't going to do sedation. Now they're doing it. You know, from my perspective, that gets kicked up to, you know, I'd say EC and look at
Right.
temporary
I mean,
suspension.
we would still move
dental
forward
license.
like we have been.
Right.
Does it hurt does it hurt our standing in the disciplinary realm at an ISC? Well, this was before the rule clarification, and I appreciate and agree with what you said. You know, as we read that first part, you know, we can conduct an inspection to enforce. Oh, we're going back out. We don't have to call it a tier 2 or whatever. I'm nervous about making the rule change right now and how that's going to hurt us trying to enforce appropriate disciplinary action on people that these people shouldn't be receiving grace.
Ms. Nichols, you were gonna.
I think I'm withdrawing.
Okay, well, if it comes back up,
Well,
please raise your hand.
Since I'm here, what I was gonna say is, one, look at us wanting to push a rule change and the committee not wanting to. This is one for the record, but
What's going on?
But I don't think to the point about, you know, not wanting like some kind of freeze effect on people currently maybe facing some kind of disciplinary action. What we're asking to do is to solidify what we're already doing.
Right. And I think I see that. I mean, I understand, and just because many of you all were not on the committee when we wrote this rule, the intent was that the tier 1 inspection was the initial inspection. And if it was a minor problem and it was going to be left to the agency to decide what was minor, they could create an attestation. But bottom line is, we told every licensed dentist that had an anesthesia permit what we were going to come into their office and look for. Nothing was new. It's embedded in the rule for that reason. So it wasn't a surprise. It wasn't something we pulled out of there. We said, we're going to come in and we're going to look at this. And if you have everything you need, we're going to check the list off. Well, it gets into waste, and a lot of this all started with the respiratory rate. And it's because the rule that talks about respiratory rate was not a new rule that we worked on. It was already there. And that respiratory rate kept coming up and said, well, we took blood pressure, but we didn't put the respiratory rate number down. They said they were breathing, but we didn't say how fast they were breathing. Well, that's not often important. It can be, especially if using a narcotic and someone's really narcotized. The respiratory rate is really important to understand why they're hypoventilating and retaining CO2. But do we need to get that every 5 minutes? I mean, in the anesthesia world, it's not the same number of parameters that we're asking our dentists to do. So they're trained by anesthesiologists and people in the anesthesia world, and that's the training that's not given back to them the way our rule is written. So it was a learning curve for all these people. So they signed these attestations that we're going to correct the respiratory rate. And then somewhere it got down the road, maybe it was a blood pressure, whatever. There was a lot of latitude on that initial inspection. But the point was that these people that had a problem, they'd be picked up in an ISC because they would have to submit a record. And these people that were inspected, we realized that the record that they submitted didn't have a preoperative checklist or didn't have the vital signs even written down or whatever. Those automatically we've identified because there are the problems. And the people that follow the rules probably aren't the problem. I find that 10% number kind of an interesting number, as Dr. McNeil pointed out. I don't know what criteria y'all chose to go in and look again at these offices that happened 20 years ago. But the point was, you don't want to spend a lot of money and resources to do inspections when it's not going to find anything other than spend tax dollars money to go in and look. If we have problems, I think we should go after it. If it's a record keeping problem, I'm going to leave that. Either we can talk about it as a committee or we can talk about it as an agency. How much money do we want to spend to go after someone who has a record keeping problem? And that's really why I wanted to know if we were overtaxing Dr. Bell's department on ISCs and level 2 tier inspection, because the difference is we choose those 5 inspection records. So we're going to pick randomly as opposed to here's what I'm doing. Well, tell me what you're doing. But if you're doing something different and we see that, all that information needs to go to the DRP, even though it may not be an anesthesia complaint because they have an anesthesia permit. And that's what's going to generate that tier 2 inspection of people that don't have their C. We get someone that doesn't have their C and they've already been inspected. That's an affidavit they've already signed. But we're not prosecuting it that direction. That was the reason we created that tier 2, was not necessarily because we're going to move from a 1 to a 2 on inspection, but we had to have that ability. If someone completely is scary, we're going to go after, overdose and drug death. We're not going to let you keep going. But the point of the tier 2 is you've signed an affidavit. So when you get a complaint against it and you have an anesthesia permit, we're going to go after you then. And the inspection's already done. So it's like re-inspecting those people that have already been inspected. But that was the intent when we originally wrote that rule. Yeah. Am I misspeaking?
No, I agree.
So I personally, and I may be reaching for the committee, I would like to see some language if council would like to present something, maybe the next board meeting, we can discuss it. We can, y'all have heard our comments and our thoughts. You can go back to the agency, talk to Dr. Bell and talk to Lee, see kind of what's going on and present something back to us if you think there's a way. I disagree strongly with Ms. Diamond's 30 days, but she has a good point. When does that first inspection in? And we really can go and inspect anybody anytime. We have that statutory, whether it's for anesthesia or for autoclaving, right? We just got to have a reason to go in there. And that's kind of why I'd say you might be reach out to Lee and see what is the trigger for that reinspection of the 500 offices or whatever that signed these attestations. What's driving them to go back all of a sudden and look at them? But I think I'd need that as a committee motion. If someone wanted to make that, I can't just order that. So
just a question for legal. Do you guys have language you've worked on that you would propose? Are we at that
I don't think we got to that.
No. We're not ready.
Do you?
No, we did. I don't. Okay. No, not at this time.
do what?
Dr. Bell had her hand raised.
Oh, she's welcome to listen. I'm not necessarily recognize her. It's up to her if she wants to.
Dr. Bell had her hand raised.
Dr. Bell.
You re-mentioned overtaxing, and if we go by the 10%, that's an additional 40 more cases. If the other 400 or really 420 if 10% of them also have this issue, well, that's another 42 cases. So, I mean, something like that probably would overtax us. It just depends on kind of how it's spread out, if you will. So that's why I was mentioning if there's an avenue to just cite the ones that didn't, the things that aren't patient care related. But I mean, there is some documentation that's patient care related. Clearly, that's why we're all here. But the things that do not directly impact patient care, and we would lean on y'all to tell us if there's a category that just goes to a certain area that doesn't involve DRP, obviously that would be helpful. But I also see the value in doing the full tier 2. So, that's why y'all got boss on your hat.
Thank you, Dr. Bell. Ms. Nichols.
And the remedy to disagreeing with the defense bar is to clarify our position.
Right.
So
it hasn't been tested at SOA. We haven't lost this yet.
right.
And this has just been brought up. And I can appreciate, hey, we identify a potential problem for us. How's the best way to handle it? I'd much rather catch it. And I feel sorry for the guys that are in limbo too, in the rulemaking. Maybe that's their get out of jail card free, right? I'm sorry, it was before the rule was clear. I don't know, but I also don't want to let those guys off because we wrote a rule. So Dr. McNeil makes a good point on that you wouldn't want that attorney then to come in and say, whoa. You've written a rule now. This was taken before you.
Well,
Do we need to make a motion?
It would have to be right now.
Staff
We're just in
to
discussion.
help write the rule.
If you want to make one, there's no motion on the floor.
Yes, to answer your question, a motion would be appropriate.
I so move.
Dr. Kears makes a motion. Would you like to state your motion?
To direct staff to give us proper verbiage on the rule that's already written.
It's
As-
110.18.
Yes.
110.18, any language change to maybe correct this situation.
Exactly.
Thank you. There's a motion by Dr. Kirsch to direct and seconded by Dr. McNeil. Is there further discussion on this committee? Seeing none, we'll have a roll call vote for the motion on the floor for the staff to propose some language for the next anesthesia committee meeting that address this rule. Dr. Kirsch.
In favor of.
Dr. Henderson, in favor. Dr. McNeil.
In favor.
Ms. Jones.
In favor.
You almost got a doctor.
Yes,
You almost got a doctor.
She's
You're
close.
close. You're real close.
Almost there.
Yeah, they're almost there. I'll give it to you early.
Okay.
She's gonna earn it.
Yeah.
Don't let anybody give you that.
Ms. Stutter, do you have any comments or thoughts on that rulemaking?
No, we will go back and have that ready for February.
Perfect. Do we have any further announcements in the agenda order? Seeing none, do we have any announcements by committee members? Thank y'all for participating today. Look forward to seeing everybody tomorrow. Do I hear a motion to adjourn?
So moved, McNeil.
Dr. McNeil makes a motion to adjourn the meeting, seconded by
Second.
Dr. Kears. All in favor, say aye.
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 Close.